Morning, it's 9 o'clock on Monday, November 15th, 2021, and the Board of Supervisors is in session in our formal board room on the fourth floor of the courthouse. We are also live virtual with Zoom, and welcome to those folks who are both here in the chambers and also on Zoom. We begin our meeting with the opportunity for there to be public comment. At this time, if anyone wishes to address the board about matters which are on the agenda, you can go to the podium and state your name and address, and we will listen. We can't do anything because it's not on the agenda, but also if you are on Zoom, you will raise your hand in the reactions button on the bottom of your screen or enter a comment into chat. So we'll hold for just a moment to see if anyone wishes to speak with us. Very good. No one in the virtual world, and we don't have anyone at the podium. First on our agenda is a proclamation, the Dubuque Service Partnership and Vaccine Clinic Volunteer Appreciation Day, and Supervisor Potoff will read the proposed proclamation into the record.
Dubuque Service Partnership and Vaccine Clinic Volunteer Appreciation Day. Whereas the World Health Organization has reported an outbreak of thousands of cases of novel coronavirus 2019, COVID 2019, and declared a global pandemic in March of 2020, prompting federal, state, and local proclamations. And whereas in response to the pandemic, AmeriCorps seniors, AmeriCorps, and the United Way of Dubuque area Tri-State filled a vital role in assisting local public health agencies by providing volunteers to staff the point of distribution pod vaccine clinic, which provided thousands of vaccines to members of our community. And whereas the volunteers accumulated over 2,900 hours, saving local public health agencies an estimated $68,347 over the 5 months the pod was in operation. And whereas the volunteers were a key resource in our fight against COVID-19. Now, therefore, the Dubuque County Board of Supervisors do hereby proclaim the 15th of November, 2021 as Dubuque Service Partnership and Vaccine Clinic Volunteer Appreciation Day in Dubuque County, Iowa. Proclamation adopted this 15th day of November, 2021.
Do we have a motion?
I'll make a motion to approve the proclamation.
And I will second that motion. Motion is second. All in favor say aye.
Aye.
Aye, that motion carries. I feel like we should applaud this one for all that's been done. True. Marie, I know you're present. Did you want to come to the podium and make some remarks? Introduce yourself too, if you would, please.
Hi, everybody. My name is Marie Zaromsky. I'm the director of the Retired and Senior Volunteer Program, which is part of the AmeriCorps Seniors. And we just really appreciate you taking the time to acknowledge the volunteers that served at the COVID-19 vaccine clinic. I think this is a really great example of how when government, nonprofit, and community organizations work together toward the common goal. By the numbers, you know, through the proclamation you heard, it was 2,900 hours of service, roughly 68,000 in value. And on its busiest day, we supported 1,400 people coming through that clinic. But more importantly, volunteers connected the community to the providers, welcoming, screening, transporting, wayfinding, getting them safely back out the door. Thank you for your time and talent. The vaccine clinic would not have been as big a success without your contribution. So thank you very much. Thanks, everybody.
Thank you, Marie. And did you want to join us up here? We'll snap some photos for you.
Love it.
Present you your proclamation. You can give your phone to Ed. He's really good with that.
I sanitized it before I came.
Be official.
I would expect that, honestly. Well, thank you very much.
1, 2, 3.
Thank you. Thank you.
Thank you.
David, appreciate you being here too. Thank you, sir. Well, I think we are faced with a very short and brief meeting, but we will soldier on, as they say. Next on the agenda is the approval of the minutes of November 8th.
I'd make a motion to approve as presented.
I will second that.
Motion and a second. All in favor, say aye.
Aye.
Aye, that motion carries. Today, we do not have consent items or procurement procedures. There are no public hearings scheduled. We have no plats to approve, and so we have an action item presented to us. There's some need for some general discussion about the Urban County Coalition legislative priorities. I'd ask Ed if you would go to the podium maybe, and I wasn't able to make the meeting on Friday, and just if you could update us with regard to whether are there changes, we would not normally, in my experience, do a formal motion on this. We would just kind of have consensus. So just wondering what the status is.
This is Ed Raber, and the Urban County Coalition, a few weeks ago, our staff asked that the member board of supervisors please, in a more formal way than just consensus this year, approve the legislative agenda that you've all come up with, the common agenda for each of all 5 counties. So in talking it over with the auditor, he suggested that we have a resolution. So there are no changes to the proposal that was before the board several weeks ago. There has been some additional discussion, but none of those were put into effect. There was a small change that was considered and discussed at some length on Friday, but ultimately they decided not to do that. Harley was a participant there and led that for Dubuque County. So what we would ask is that as it was a few weeks ago, and you've had some time to consider that, to approve that as the legislative agenda, not necessarily for Dubuque County, but for the Urban County Coalition. It's the common areas that you guys have some interest for the 2020 legislative session.
Thank you. Harley, do you have anything else to add after this meeting on Friday?
It just, all the counties approved basically the agenda, what they're going to propose to the legislature for the unfunded mandates, and it was all listed on the sheet.
And I would just note, Stella, to the budget director, have you seen the last copy? There are several unfunded mandates that they want us to explore, I think, to see, as we track through our budget, what are these numbers? What is the final cost to the things that the county provides that the state does not reimburse us? So it's a state directive that the county must, but it doesn't come with any funding. And that continues to rise every year, so it's concerning. Supervisor Wickham, are you fine with taking formal action?
Sure. Yeah, I've read through the priorities and generally agree with all of them.
So if we wish to take formal action, we need a motion.
I'd make the motion to approve the resolution.
And I will second that.
We have a motion and a second to approve the resolution. All in favor say aye.
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 Aye, that motion carries. Thank you, Ed, I appreciate that. Under communications, we do have a communication. However, we have not actually received this document, so auditor is requesting that we table this. We have a motion to table.
Okay, so we don't have the letter. We do not have the letter. Just kind of jump the gun and put it on the communications. Okay. We need to table it, or? No, you can ignore it. You can ignore it. You cannot. Okay, let's ignore it. Hate to table something I don't have.
So we'll take no action?
Correct.
And you will note that we didn't have that, yeah. Right? Under the appointments, we have appointments that we need to make ourselves to 2 individuals to the compensation board. There's a meeting on December 6th, and our 2 remaining vacancies, and they are ours, so we need to designate and appoint 2 individuals to serve in that capacity. We have 3 names total. We have a brief memo that was included in our docket, in our packet, we have Mary Ann Gow, Gerald Ross, and Julie Schemmel. Mary Ann and Gerald, by the way, Gerald thinks he was your chemistry teacher, Jay.
He was. I think 8th grade football coach, so I wasn't a star.
Well, he recalls that fondly, so.
So maybe that's better in chemistry than 8th grade football.
In any event, I have spoken to both Mary Ann and Gerald, and they understand that the meeting is on December 6th, and they're awaiting packets of information and such for them to perform their task for us. So those are the two individuals that I've found in my various search around the county.
I had talked to some individuals that were going to apply and obviously haven't, so, I read the resumes and looking at the gender balance. The two females would be my pick to bring the gender balance more even.
Right. The concern I have about Ms. Schemmel is that she applied just from our blank listing on.
What?
She applied just because it was listed as an opening on our website. So I don't think anyone's confirmed that she wants to do this and she understands what it is that she has to do. That would be, I did speak to Gerald Ross. That's my concern. Has some experience in negotiation, and certainly that's what that meeting is. So that would be my response to, there will be, obviously, Mary Ann, half of our representatives would be women. You might look at it that way as well.
Okay.
Supervisor Wickham?
Would the board, we haven't done this in the past, but I think I personally made my comments related to the compensation board in the past, but would the board be interested in giving some direction or objectives to our applicants?
Yes. In the conversations I had with Mary Ann and Gerald, I indicated that we would probably want to do that. Dawn is creating the packet to send out to both of them of information. It might be smart to ask them to join us virtually at our next meeting for a work session.
Here, yes. So Supervisor Pothoff, do you agree with that? Is that how you'd like to proceed?
Yeah, that's fine.
Because we haven't done that in the past, and in my opinion, the compensation board it's been a very clunky process. And so I think the results have been difficult to manage related to, high compensation for one area, and then based upon the pro rata and the percentages, you've got to slice and dice those compensation issues, and traditionally have been much, much higher than I've been comfortable with, and I've voted against them the last series of years. So I would welcome that, but I don't know if that's going to help much from my previous oversight, oversight's the wrong word, my previous participation in listening to the compensation board. But I'm open to that. But we obviously had a 2-to-1 vote, haven't agreed on what those priorities should even be.
Yeah.
So, are we going to, it's basically numbers, what you're talking about in percentage of compensation increase. Right. And so does the board, maybe one level deeper, does the board anticipate identifying a number to our group to go in and to advocate for not only our position, but for others?
I have talked to both Mary Ann and to Gerald and indicated that we would like them to have a position and an understanding of the process. I have not told them that they are to do X, Y, and Z, because I think we're selecting them as representatives of the community with general knowledge. Mary Ann is a career, lifelong legal assistant, quite capable. Gerald's negotiated for Western Dubuque schools, so I think I've tried to kind of select for talent, but I haven't told them they will do what we say. And I know you don't mean it that way, but yeah, I do think they want to be formed and they want to be informed.
Yeah, and I don't know if that's our role to inform them how the process works, but, they're there, it's compensation, to represent us related to compensation. The unique role the supervisors have is the ability to roll back or change those compensation levels. And so when they're not even, and when one's at 14 and one's at 3%, if you cut them in half, one gets 7%, one gets 1.5%. And so you just get these inequities that I've constantly seen over the series of years. And so just one year, at the request of the Board of Supervisors, they went back and made them all even, which made it, in my vantage point, more fair and equitable if you are going to make a rollback. So anyway, I mean, I think I guess what I'm asking, so if we're not going to give them the number, it's not that critical who's in those seats, because they tend to get overrun by those that are more senior or representing those that have a higher number in mind. And that's been the sheriff's office traditionally.
But,
and God bless them, that's what they do. Ken Rundy's been wonderful on that board and has advocated for the sheriff's department in really good fashion and has gotten them compensation increases well and above the rest of the elected officials and their deputies.
so what I've tried to do in selecting individuals, I've told them there are strong personalities. People tend to take a hard position and dig in, and they both are prepared for that. They both are aware that it frequently is of note in the newspaper. They haven't always agreed with our decisions. I think that's great. Those are the kinds of citizen engagement we want. And I've chosen people, I think that, one, they're going to show up. That's a big deal for our representatives, that they both come and that they are prepared and that they actually can stand against some strong personalities. They are not going to be meek, I don't think, in the face of individuals who've done this more years. That's just a factor to them, not the final verdict. So that's why I'm liking these folks. I think they're very good choices to represent us.
I think they're wonderful people as well, but if that board comes back and or people vote for wage increases higher than 5%, I'm going to vote no again.
I understand.
So I think, thank you. And so, I think that's kind of what I'm getting at is that, if we're representing them, or excuse me, we're picking them to represent us, my vantage point is a number less than 5%, 5% or less. I think 3 to 5 was my range I've stated in the past, whereas my colleagues to the left, both of you, have voted higher. And so that's kind of what I'm asking is, are you still in that same position of higher than 5%? If so, then your designees can be selected and understand that.
And I'm not sure that we should be discussing that, honestly. That's not what's on the agenda. We are to make an appointment. We are not to start the discussion
I
of
disagree.
what compensation.
I mean, you're not judge and jury, so I mean, it's a compensation board, and this is the exact reason the compensation board is numbers.
Appointment.
And so I'm asking how my colleagues feel about it. If you guys are ready to pick a person, go for it. But I think it's appropriate to have discussion of what our representatives will do.
Well, they have a job to do. Saying that you're not going to go over 5%, which I'm not in favor of the big raise either, but if they can show that this person is not comparable to someone else in the same position and needs to be brought up, I'm not going to be against doing that. Similar to you as a supervisor getting $25,000 and the next county's getting $50,000. Well, do you think a 2 or 3% raise would be fair to catch you up to where you should be? I don't. I think we have to have equity in our positions to keep the people here that we have. I'm not in favor of throwing away a lot of money, but I want to be fair to everybody also. And that's what their job is. So I'm not going to put numbers on it. I'm going to wait to see what they have.
And that's okay. That was my question. And so I'm happy I understand that. It sounds like Supervisor McDonough also doesn't want to recommend to them a number. And so I understand that. And that's what I was looking to gain knowledge on. So thank you both.
That I would share as we look at these appointees is that I personally have begun to ask our elected representatives. I've asked the auditor, asked the county attorney, tend to ask the treasurer, the recorder, what are they recommending to their designee? I mean, eventually the number that's proposed, 4%, 8%, 12%, 20% in pay increase, that is the swirl around that compensation table, is that being owned by those other elected officials? So where are they at this time in saying that's how much of a raise they want? Now, I'm not doing that as the chair. I just am doing that to say, I think that's noteworthy information. Where are the elected officials in what they wish to have be a raise? And that would be something that doing that myself. And if y'all choose to do that, so be it as well. But if we want to have a work session with these individuals for any educational purpose, we certainly can do that. There's going to be some information going out. I intend to meet with them when the information is being processed, so we've got all their questions answered, and they feel like they have the information they need to represent us.
We didn't have a time frame on these applications, did we? We didn't have a ending time, so hey, apply by this date. No, we did not. Yeah. So these were in the quarterly process that we spoke about last time. I'm happy of selecting 2 out of the individuals today. I think that, you know, unless the board feels there's another candidate that they'd really like to apply or additional candidates, I think we have our selection. So I will make a motion to appoint Gerald Ross to our compensation board.
I will second that.
I have a motion and a second to appoint Gerald Ross. All in favor say aye.
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 Aye, that motion carries.
I would make a motion to appoint Mary Ann Gow to the compensation board.
And I will second that.
We have a motion and a second to appoint Mary Ann Gow. All in favor say aye.
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 Aye, that motion carries. We will need to also formally table the appointment of the Mosalem, the replacement. But that is a document that's got paper, so we'll need a formal table for that.
Because Ken Rundy's currently in that position? Okay. So I will make a motion to table the appointment of Greg Wilging to the Mosalem Township Clerk.
I will second.
Motion is second to table. All in favor say aye.
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 Aye, that motion carries. Next, for information purposes only, we have open vacancies. Anyone wish to have comment or discussion about the remaining open vacancies on our other boards? We are, it's gone out for press releases. Tanya's released that, so she's getting some back from folks as well. Next, the personnel requisitions, we have 4. The first is for a part-time intern for the IT department. Here's, we typically have 1 or 2 part-time interns.
I would make a motion to approve the part-time intern for the IT department.
And I will second that.
Motion is second to approve the personnel requisition for IT. All in favor, say aye.
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 Aye, that motion carries. Next is a permanent full-time custodian to the courthouse. Dawn, I asked you about these 2 positions, if we needed to fill them both due to we are doing far less cleaning, I believe, and touch surfaces. So is there a need, now that COVID has changed direction, to make any change?
I also, Chris Soder is also on the Zoom. I did speak with him about this. I think maybe what you're referring to is about a year and a half ago when we did have COVID, we were having some issues out at the West Campus with some of our contracted housekeeping services. And so you as the board agreed to move a part-time position, custodial position, to a full-time custodial position. And then we ended that service contract with the custodial services. So Chris and I discussed that. We do believe we do need to fill it as a full-time again, because we're not anticipating or not requesting that we employ any contracted custodians for the West Campus.
So because we haven't made a request, is that what you're saying? Because the supervisors haven't made a request to make a change, we're moving forward?
No, Chris and I are requesting that we fill this position as a full-time position. There's enough hours of work. We're no longer having any contracted services come in, so all of them are our employees, and that was why we made the move last year, because we wanted to end those contracted services because we're not seeing the quality of work that we wanted.
And is that the same discussion then for the next one, which is a permanent
Correct.
part-time?
Correct.
So it's the feeling that we need to continue the current staffing.
That is correct.
Well, my comment would be, the courthouse seems to be very clean. I'm not in here as regularly as the rest of you, but it seems to be very clean, and seems like, generally speaking, the custodial staff is doing a good job. That's my observations as a part-timer in the courthouse. But whether we need another one or support this position, I guess I'm not as fully well-versed.
I think it's just replacing somebody that's leaving, right?
Correct. We have a retirement, and then we also have a resignation.
Right. We're not adding anything, we're just replacing.
That is
I was just asking about whether the workload, because COVID seems to have changed in terms of our response, is the workload sufficient? Is it time to make a reduction? And apparently the answer is no, both positions are needed. One is permanent full-time and one is permanent part-time.
I would make the motion to approve the permanent full-time and permanent part-time custodian positions.
And I will second that.
Motion is second. All in favor say aye.
Aye.
Aye. Motion carries. The last is a permanent full-time corrections officer, due, I think, to a promotion. We have a need to post a new opening.
I would make the motion to approve the permanent full-time correctional officer.
And I will second that.
A motion is second. All in favor say aye.
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 Aye, that motion carries. That completes the formal portion of the Board of Supervisors meeting this morning. We do have numerous work sessions that will follow here shortly. If anyone wishes to make public comment at this time about any item that is of concern, you may go to the podium if you're personally present, or in Zoom, you would raise your hand in the reactions button or enter a comment in chat, and we would unmute you. We'll hold for a moment. Seeing no one wishes to speak, we'll move on to our first work session, and that is with the county auditor to discuss upcoming re-precincting plan and timeline. Good morning, Kevin.
Good morning, everybody.
Good morning.
So we have the re-precincting process for Dubuque County that we started within the last 45 days or so, as we waited for the state to issue and approve their final maps. My communication sort of outlined a timeline of what we're looking at and may have preemptively answered any questions. This purpose of this work session is to just sort of go through that memo and make sure that everybody's comfortable with the timeframes. So I'm happy to answer any questions to start.
I think you should also just catch up everybody that, you know, we were in Luxembourg and visited with the mayor there, and any takeaway from that meeting you had with his response to things.
Correct. So the redistricting process for us is we take our state maps that were approved on November 4th, and we use those lines to redraw our precincts looking at population and compactness. Those are really the two key metrics that our GIS department used. Each of our GIS employees, of which there are 3, prepared a map that they then presented to myself. And I took a look at the maps, and what we're looking at is a reduction in precincts for the next 10 years. So we would be going down 1 precinct, and we're able to get some good compactness in there. And I've individually met with each of you to sort of answer any questions. In a typical year, this process would start in May-ish and be completed by the end of August. This year, with the delay in the census data coming down from the federal government, we're all sort of scrambling and working concurrently instead of consecutively. So I have been in contact, and our staff has been in contact with the City of Asbury, City of Dubuque, and the City of Dyersville to make sure that everybody is sort of working together to make sure that we can pass a map ordinance through this board prior to January 15th for submittal to the Secretary of State. Once it's submitted to the Secretary of State, they can then look at it, they could say, we don't like this line, or we don't like that, and then they can return it to us for revision. The key here is that we want to make sure that we get it submitted to the Secretary of State with enough lead time that if there were to be a revision, which, to be clear, we do not expect that to occur, but that if there was, we would have enough time to redraw what they needed and submit it to the Secretary of State prior to that 15th of January deadline. If we were not to make that deadline, any revisions would be made by the Secretary of State. And that's something that typically counties and cities like to have control over where their lines are drawn. So we would work to avoid running into that deadline. And then we did meet with, I did meet with the mayor of Luxembourg to discuss the new precinct locations. There's some house districts that the way they were drawn take out a township in northern Dubuque County. So that sort of makes it a little island up there. But we were able to come up with some good maps that work for the compactness of that area and that work for population size, so that we're staying below that 3,500 person threshold.
I appreciated that Kevin wanted to go out to Luxembourg, visit with Roger Oberbreckling, that his citizens are not going to be voting in the place they thought they were going to be voting. Likely. I know that's the decisions you've yet to make, but just to make them aware.
Polling locations are not determined until the maps are finalized. And when our GIS staff draws those maps, they're using those two criteria of population and compactness. They do not factor in where polling locations are, where polling locations could be. We don't factor in addresses of current or future or potential candidates. We're simply drawing to try to be as compact and as solid as we possibly can. So the timeline on page 2 would have on the agenda tonight for the city of Dubuque in their meeting, there is a notice of public hearing to go out on their agenda. The city of Dyersville, I haven't had as much communication with. There is a item on their agenda for this evening for discussion and possible action. I am trying to get a hold of somebody from Dyersville, and if I can't, then I will attend that meeting this evening to sort of relay the concerns of making sure that we're all trying to stick with the timeline. We've had fantastic communication with Asbury and the city of Dubuque. And so Asbury will look to, on the 23rd, approve their notice of public hearing, which would then put ours on the 29th. So we would have a notice of public hearing going out, which would list the description. It would publish the potential map, and the only difference there would be the description would have to be determined in the ordinance numbers from the cities, because obviously their ordinance wouldn't have been passed yet. But this goes back to the having to work concurrently instead of consecutively. That would lead to the city of Dubuque on December 6th holding their public hearing and approving their ordinance. The city of Dyersville, if the timeline holds true, would be doing the same on that day. And then the city of Asbury would hold their public hearing and approve their ordinance on the 14th of December, which would allow us to then hold our public hearing and approve our ordinance change on December 20th. And given the tentative information that we've received from the cities on their lines, we've been able to complete our map and complete our new ordinance, as well as our descriptions and precinct agreements that will ultimately fall into place. So provided we can get that notice of public hearing published or approved for publication this evening from Dyersville, the timeline stated in the memo would hold true. If Dyersville does not have the notice of public hearing go out today, it would push us into the beginning of January, and it would eliminate our opportunity for revision should the Secretary of State come back with any questions or concerns or redrawing requests that they had. So here's to hoping that discussion and possible action leads to a notice of public hearing this afternoon or this evening. And then on a personal note, I'd like to thank our GIS department, who normally they have 90 days-ish to do this process, and only one has been through a precincting before. And all three of them came together with fantastic maps, and we sort of took the best parts of each of their maps. So really kudos to them. They did a fantastic job. Any questions?
I have nothing.
No, thank you for your email and our letter there. It helps, lay out the
This is
steps
the
very
time,
well.
we're not gonna look to field too many questions on December 20th, so if there's a question, let me know.
And my question has just been the concern that citizens are aware. We don't expect there's going to be big changes in terms of precinct movement,
Correct.
and it doesn't affect, because we are all elected at large, it doesn't affect us the way that the state maps do for residency of elected officials.
Correct. I'm likely to not comment publicly on polling locations and where they'll end up until the board approves the map. That's the order of operations we work here. And so frankly, with the exception of a handful of places that I've looked at that I know we're gonna have to create a new polling place because it might be a new precinct or a new location, you know, I haven't looked too in-depth at that as well, so. And, you know, any of the cities could throw a wrench in there at any point, so.
Great.
But that will certainly be a component, there's always the component of education, there's always notification before every election of where people will need to vote. And our proposed map will be published with our notice of public hearing, so that will be out for everybody to see at that point. And that's looking to be, again, the end of the month-ish.
Anything more for the auditor?
Nothing from me, thank you.
Thank you.
Thank you,
Thank you
Kevin.
for all the time you put into this, and, like Jay said, the emails,
Thank our staff.
you too, Jeff, staff, appreciate it.
Very good. All right, anyone wish to make a motion until 9:40? Just a brief recess here.
I will make that motion to recess
I will
till
second.
9:40.
Motion is second to recess until 9:40. All in favor say aye.
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 Aye, we are in recess. All right, let's go back into session. And this work session concerns the allocation or spending of the $1,069,000 remaining in our Fund 10 account with the East Central Region. So Stella, do you want to give high level, and then I'm going to ask May Hinchin, who's with us today, to come to the podium as well, and we'll have some question answers with her about structure and just some thoughts.
Sure. Good morning, everyone. So today, we just have time for open discussion from the Board of Supervisors to discuss the presentations that you've seen over the last month or so from the organizations presented on the screen. So if everyone recalls, we got lots of applications through Rescue Plan and other sources to spend down our MHDS Fund 10 fund balance. The state made changes to mental health funding in the last legislative session. So as of June 30th, 2022, whatever's left in our Fund 10 fund balance will be surrendered to the state. So we are trying to actively spend that on local community projects if possible during that time, before that time frame ends.
Okay. So I've asked Stella to put together a spreadsheet like this. It has everyone who's come forward and asked us for funding and presented during this to us. The top two lines, of course, are the awards that have already been made, and those are approved by the region and they are underway. So those folks should be billing, and they understand that all funds have to be spent by June 1st. So as I look at the others, so it's a balance of how do we get through this in a way that has good discussion and maybe obviously full-throated discussion between supervisors, but there are some that I think can be removed so immediately. Which line are you looking at?
I was looking for the Hillcrest Family Services staff recruitment and retention. They have formally asked to withdraw that request.
Number 20.
Line 20.
So how do you wish to do that? Do you want to move it down lower on the screen?
No, I think we would just put 0 next to it. They've, formally withdrawn that. So we just would say thank you for presenting, and thank you for letting us know that you would like to withdraw that. So it's not going to be part of our discussion today.
Just a question, Stella.
Sure.
Any of the entities that presented under this would still be in the ARP funds, correct?
They could. So pending the discussion today, it could be thank you for presenting now, but we would like to consider your request when we look at rescue plan funding it as a whole.
And so if we just take that as a moment, there are two of the applications that are likely to have funding opportunities with the state of Iowa through another funding mechanism. And May, if you want to come to the podium and kind of share space a bit with Stella, as you and I have been through this list, that other entity is Hills and Dales, correct?
Correct. Good morning. So before I talk about that, I do want to make one qualifier. Any money that is left in Dubuque County Fund 10 balance as of June 30th of 2022 will be surrendered to the region. If the region is over 40%, then money goes to the state. So it's not a direct from Dubuque County to the state incentive fund. It will be to the region, and we're managing regional funds so that we're not over 40%. But if each of our counties, whether it's Dubuque County or any of our other counties, their transfer to us on June 30th bumps us over 40%, then of course money will have to go to the state. So just, there's an intermediary there. Thank you. Yeah, no problem. So yeah, Hills and Dales also have requested the Employee Stabilization and Capacity Building Funds at $325,000. The state of Iowa, the Iowa Medicaid Enterprise Program, has budgeted $60 million of their ARPA funds for direct care staff support. So there is a considerable amount of funding available for providers who have Medicaid billable services, which Hills and Dales services, most of their services are Medicaid billable. So they have, the application is already out, And I hear talk that the state wants checks out by January 3rd. So that assistance to providers will be coming pretty quickly.
So Sunnycrest would be eligible for that, or things
Probably,
it's
I
not?
don't think so, because that's a different service. It's services, the Iowa Medicaid Enterprise, they might have something for that, for like nursing type care. I don't know about that. This $60 million pot of money is for providers who have HCBS programs.
Okay.
So, and I'm not saying that there might not be some support for that Hills, or that Sunnycrest could access, but it wouldn't be that pot that I'm talking about.
Okay.
And then the other, that I think is that we should talk about, is the Take Care Center, the $2 million request. I think that also is not, before us today. It's not something we can spend by June 1st. It's a federal request, and Ann's indicated that, I think, in an email to Ed, that it's an application she submitted for our federal funding. It doesn't fit, in your opinion, here with the fund balance spend down. Is that your thought?
When we think about fund balances, and the way we've always thought about fund balances from the regional perspective, is pilot programs, if you will, or programs that will really support the advancement of local services, right? So there have been a lot of fund balance projects over the years that were just kind of like a boost in the local economy because they needed something at the time locally, right? There are relatively few of the fund balance projects over the years that have ended up being long-term sustained projects by the region. I'll give you one example. The Access Hub in Benton County, they've paid for that out of fund balance projects for the last 3 years. Next year, because the region supports Access Hub, it'll come under our operational budget. We'll support that. We already support, as you know, last board meeting, the Regional Governing Board voted to support the Access Hub here in Dubuque County. So that didn't start out as a fund balance project. It just kind of went right away to the regional operational funds. The rest of projects that have been in counties have been more likely a lot of bricks and mortar type things. And the study that the Community Foundation and Hillcrest is doing, the study. Yeah, like one-time projects, the study for the geriatric brain health issues that Hillcrest is doing, that's a really good example of fund balance dollars as well. Training, those things are kind of one-time expenses and won't obligate the region for long-term operational support unless it turns out to be a worthwhile project that we think would benefit perhaps the entire region to expand it.
So I guess to my colleagues, what I'm proposing is that in each of those, so line 20, we place a 0 for purposes of our document today. So line 20 would be a 0. Hills and Dales is line 23, that would be a 0. And then the Take Care Center, which is Dubuque County, 18, those would be zeros.
I'm certainly comfortable with the Hills and Dales and the previous one. I forget which one it is that you were 0 with. Thank you, Hillcrest. I would like to hear from Ann Cameron Williams related to the Take Care Center and her vantage point on how important it is. She put the application in, and I'd love that opportunity to hear from her before we zeroed it out. But the other two, for sure, I think seem to make sense from what you've explained to us.
Ann, do you want to come to the podium and talk about whether that can be zeroed out from this account?
Such harsh language. Zero it out.
Good morning, and thank you.
Good morning.
I'm going to defer to May's comments here. The Take Care Center concept has really, when you boil it down, is an expansion, a slight expansion of the existing Department of Mental Health and Disability Services. And that would include a little bit more outreach, certainly some resources for people that are looking for brain health stabilization, and some of the other factors that contribute to that. When it was submitted with the intent of being considered as an ARPA project. I did massage the budget a little bit so that should it be approved at this cycle, should you have needed to leverage more of the fund balance projects this year, so that we did not have to give back any money to the region at the end of the year. I believe that's a $278,000 line item beginning in January and moving to the end of this fiscal year. Should it be reconsidered, and I hope it will be reconsidered as an ongoing ARPA project until December 2026, that would be awesome. But I think it's there, you know, at first when we started out these conversations, not sure that we had all of these projects on deck yet. And the thinking was that if we didn't have enough projects to fund within the Dubuque County community for brain health, then you'd at least have $278,000 worth of fund balance that you could leverage so that it stays in the county. I hope that answers your question.
So it would be my proposal then that we place a zero in that account. It's not funding that can be spent by June 1st.
I think I just heard $278,000 was the request in the proposal for this fiscal year.
Correct. The revised.
I'm not saying I'm against putting zero in there, but the revised plan,
right,
obviously $2 million would be very challenging to implement in a very short time. What you're saying is you could launch with $278,000 worth of funding immediately.
Beginning in January, that's how I just budgeted it out.
Is that for office space, Ann, or for personnel?
I did present an entire budget to the Board of Supervisors, and it had salaries of new personnel. It did have rent. It did have some new equipment in it, and it did have some training dollars wrapped in, some marketing and things like that. But it was spread over the entire, from January of 22 until December 2026.
And May, is it your opinion that those pieces Ann's discussing can all be addressed by the region? Training dollars, any new personnel?
Those proposed expenditures certainly could be addressed by the region, should the region determine those are needed. But unfortunately, we haven't determined that that's needed. So if you implement it now and you do a fund balance project with it, new staff, I mean, training, you know, is worthwhile when you get it, but new staff, we haven't identified that that is a priority for the region to have more staff in Dubuque County. And so I can't say that we would, July 1st, we'd take that over.
And that might be true with a lot of these programs, correct?
Correct. And that's why, you know, a lot of them are one-time things, you know, the training. And so that's like really good, appropriate use of fund balance dollars.
Okay, thank you.
So it'd be better if that went to like the ARP funds and we had it in place for a year to see how it works, and obviously if it works, then try to move it to the ECR for funding?
Certainly that's always the option, but I will tell you that there's no other county in our region that has a structure like that. That's why we haven't identified it as a priority, right? No other county has additional staff that do outreach. We, as the regional system, support our providers in doing that because they're the ones who are on the ground, you know, and meeting the people every day. So I'm not saying it's a model that we couldn't think about. It's not implemented anywhere else in our region, so we would have to spend some time studying it and like you say, Harley, determine if it's effective or not.
Somebody's always got to be first, so.
Yeah. Hence the pilot, right? That's
yes,
the comment
exactly.
was pilot, the word you used. So, okay, thank you. That helps. Thank you, Ann. I just wanted to understand more about the Take Care Center and your vantage point while you're here before it went to zero, if that was where the board took it.
So again, that is my proposal, that those three be placed as zeros in this allocation of the $1 million for mental health funding.
You're taking it to the region, so you're gonna be leading, in my opinion, so.
Do we have consensus on that?
Yeah, that's fine, as long as, I mean, like I said earlier, that these all go to the ARP if they're not accepted here.
They can go anywhere. We also have our general basic fund and our strategic investment opportunity. I mean, there's other things, purchase of services, so, but for purposes of spending the funds today, I think that if we can put zeros there, we can start to see what there is for spending opportunities. So is that how you're leaving them, as determined then?
I'm just filling.
I just don't see a zero. Should I expect a zero or no?
You just change their formatting.
That formatting, that little dash is a zero in the formatting.
All right, there you go. The next thing that I'd like to have May also comment on about the purpose of the brain health projects. I would like to tackle the big one, which is Mercy One. And,
Yeah.
it's line 24.
Sure.
And they presented to our Board of Health, and we had some discussion with them. You and I have talked to Mercy together. Ann was in the room. We've had some comments with them, and it's this is certainly what I think fits the best into what a fund balance project is intended to be. But I wanted to just have you be able to answer questions or comments. And I would put $500,000 into that line, because that's the kind of fit that I see it be. It's countywide, it's pilot, it's something that if it really works, the region might consider supporting on an ongoing basis. But it's brain health, it's outreach, it's assessments, it's prevention, all the things that we would want the fund balance projects to be used for.
So first of all, the Mercy's proposed mobile unit, if they were going to do some public health things with it, as well as brain health prevention and treatment with it, it fits the first goal in our strategic plan, which is access, right? So we have a goal around access, making sure that people, and we talk about access lots of different ways, availability of providers, geographical distance, those types of things. So if we have a mobile unit that's going out to people, that really addresses access in the rural part of the county. The other thing, and I know it's early and they're not up and running yet, but I did have a kind of a pointed question to Mercy about, will you take this a little bit further than just Dubuque County eventually? And they indicated an interest in moving on to Delaware County and Jones County, because that's kind of in their service area. So that's of interest to me. I think that's probably a year or 2 years down the road, which, and as you kind of then insinuated, the region could provide some operational support for that. When I talked earlier about fund balance projects have in a lot of counties been bricks and mortar, even though it's mobile, it's bricks and mortar, right? The startup for getting the mobile unit going is bricks and mortar to get that going. So yeah, I think that's
And other counties over the past years have spent millions out of their fund balance dollars creating access centers.
Yeah.
The construction costs, the consultant costs, the renovations. So that might seem like a large number here, but it still is, in the regional history, a modest amount of money to get and pilot a new way to deliver services to people. You know, the letters of attachment to Mercy are from the chief psychiatrist and from the emergency room physician, Dr. Gordon and Dr. Porosky, indicating that they strongly support this for those reasons. It diverts from the hospital. It potentially diverts from the sheriff's department. And, you know, I've told you before with a mayor's meeting and my follow-up conversations with members of city councils out in the county, saying that this is a need that they see, that there are senior populations, some stay-home families, some homeschooled kiddos. This could be an avenue for them to have brain health touch and brain health screening, in addition to whatever public health that they put on the mobile unit as well. So.
Is this when you want the discussion from the board? Is that what you're looking for?
Of course.
Okay.
But I put that out there first because we can
no problem.
put that number and then it can change all the time. I mean, we could even make an and column. and you put $500,000 in the "and" column, and then we can decide where would you be on it, or where are you on it?
So make sure we're on the same page. The Mercy One proposal was for the RV, right? That was the big push, and so they were here. And so definitely innovative, and so I was interested in that, and definitely would follow a pilot, and definitely would be mobile. What first comes to my mind is what our immediate needs has been, is that would have been, and is still great for testing and vaccination. That's the comment I met, and I said, are you ready to deploy that for that? And they said, yes. So my thought is, let's fund that. The brain health aspect of it, I'm as a layperson and a county supervisor, less convinced that that's either needed or requested. It appears that a large green bus wouldn't be my first choice for where I would go to receive my counseling and or brain health services, but that's just my 55-year-old impression. But I definitely applaud them for being innovative, and I think it would line up very well for other types of medical items. I'm just less convinced that it's a brain health issue. So I'm open to funding that component, but it just seems less of a fit, is my first assessment.
I would I have to agree with you, Jay. I mean, I guess if we were more rural, I'd be more apt to jump on it, but we have care in Piasta. Finley has, or Unity Point's there. We have Mercy out in Dyersville. So it's not like we don't have access available to, rural residents, because they can go to Piasta, they can go to Dubuque, they can go to Dyersville. Anybody can seek help anywhere. I don't see the brain health aspect of that working that well. I mean, for your vaccinations, stuff like that, okay, I can see that. I think it would be more of an ARP funds thing than ECR, personally.
I would say, with all due respect, that the uniqueness of the Mercy model is if they have both healthcare and brain health care in one spot, that if we think about stigma, somebody walking onto the RV unit, their neighbor doesn't know if they're there to get testing for COVID, or if they're there to get a vaccination, or if they're there for brain health support. So I don't know if I want to say it normalizes accessing care, but it could help reduce the stigma associated. I know what you're saying, like, would I go to that for my brain health care? But on the other hand, if I can feel comfortable that my neighbor, they see me walk on to the RV, doesn't know why I'm there, I might be, if I'm a little worried about that stigma, I might be more likely to do so.
So maybe here's a regional question. So you heard both Supervisor Potoff and myself, and Supervisor McDonough certainly voiced support as well. So there's support for this. Supervisor Potoff and myself are more like, hey, let's not use Fund 10. I'd rather use American Rescue Funds. That's what I'm hearing. Is there any advantage from a regional vantage point that we use Fund 10 to support this? Does that give it more momentum and more, quote, street cred for the region?
I don't think there's necessarily an advantage.
So my vantage point is, I think it's neat, innovative, needed, and I would, if this was American Rescue funding, I would probably be looking to highlight that for funding.
Right.
We're just not on that area, so hopefully that helps my colleagues to know where I'm currently on that. I would much rather spend our precious last $1 million on some of the other programs on the list for brain health issues for the region.
So
That's where I'm at.
we could put $1 there and see, as we allocate other funds, how it spends down. It could also be funded in part by the ARPA funds. This is just, we need to spend $1 million.
Agreed.
I don't think
Got a
there's any
number.
problem with that.
No, it doesn't have to be $500,000. What number should it be?
I'm at 0, so if we need to keep moving.
I think personally should go to the ARP funds.
I agree with
That's
that.
my personal opinion on it.
That's where I'm at, and so I think we have consensus, unless you want more discussion.
We have consensus.
Okay.
I disagree, but it will be zero. There's not a, that's how this works.
So would you like to just,
Mercy one saying big focus for the, big focus on the mobile unit will be centered around brain health prevention and early diagnosis, then referral to those centers for further follow-up treatment. Want to break the cycle of community members not seeking treatment until they are in crisis mode.
And if I'm Mercy One, I think you heard the board support it and we want to fund it. It's just not today. It might be very shortly. So, I mean, you can push harder, but I think funding for that is coming from what I hear from the board, just not in Fund 10.
Right.
Okay, so, how do you wish to go next then? Is there something that you feel is clearly, obviously brain health funding? We can talk, while May's at the podium, we can talk about,
What's left with whole dollars? So that's the, kind of the game you're playing is if you have $1 million left. If you highlight what's left, how close are we to that $1 million area? That's just.
well, what I was going to ask is we need to.
You asked and I just answered, so.
Well, and what I think, well, we have made it.
Sorry.
We do need to talk about Hillcrest's, request for
What's that number,
qualified,
Stella? Can we finish my request?
qualified opportunity zones, because that's also something that's not related to brain health.
it's $1,725,490.
So what's the deficit of that then? It's very close, right? I can't see the number.
750,000, yeah.
Oh, so it's not, it's 1.7?
1.7.
Oh, 1.7. Okay, so we're 700,000 over. Okay, thank you. That helps me just give context. Because we still can't say yes to everything.
Right. Well, and again, I want to talk about with May's assistance, she's also been involved in the Hillcrest. The line item is, 21.
I'm happy to do that. You asked me how to proceed and I jumped in. So sorry, if you want to lead, keep leading.
So I think this one we also need to talk about, and I reread their application again last night. This is a public health request. It is not a brain health request, and it doesn't have anything to do with what the region does. So I don't know, May, if you want to, they've approached you about this as well, and your response about the region being involved has been.
So the Qualified Opportunity Zone project really looks at social determinants of health. And certainly social determinants of health are important to us because all of those impact people's brain health, right? Having a safe place to live, having connections to the community, having access to health care. Those are important things and they do impact people's brain health. But I don't feel like as a region that that's really our wheelhouse. It's important to us and we want to be involved. I don't know that we lead the social determinants of health initiatives across our area. My opinion is that's more of a public health.
That was, thank you, I appreciate that. So my quick comment is I think that's less in my favor to approve. It definitely is, once again, very innovative, very unique, but I'm not ready to financially support that because I don't think I fully understand the results and benefits we're looking for. So I would be okay with a zero or a very low amount on that.
So let's put a 0 then. Are you fine with that, Harley?
Mm-hmm.
On line 21. We should also talk about line 12, which is the community foundations, the brain health school retreat rooms. May, I know you've had some conversation as well about that with Shirley Horseman, if you want to just make the whole board aware.
So these brain health school retreat rooms are intended, they are being implemented in both senior and Hempstead High Schools this year with a generous donation to the school district from the Butler Family Foundation to support the bricks and mortar, if you will, the materials for the rooms. So the school district, the Butler Family Foundation put the onus on the school district to staff these rooms. So the school district is looking at their own ESSER dollars, the federal dollars that they received, that they have allocated. They just sent me the budget for their ESSER dollars. They have those pretty well allocated. So they're looking for some assistance with the staffing needs. But that's only 90,000 of the 268. So the proposal that you received also includes West Dubuque and Wahlert. Would that be it? I guess that would be it. The other school districts in our county. So that would be the establishment of these rooms as well as the staffing in West Dubuque and Wahlert at Holy Family. So these are rooms that are welcoming, non-threatening for students who might be in a crisis situation. It might just be for students who really just need a little bit of a timeout, you know, and they want to go to the room and maybe put the headphones on so nobody talks to them because they're overstimulated because what's going on, especially in our larger high schools, because there can be busy places with a lot going on. I don't know if you've ever been in a cafeteria at Hempstead or Senior, but they can be overstimulating. So a place for students to go to kind of like, you know, bring themselves down, and they'll have trained staff there just to help students to de-escalate, to problem solve, to tap into coping skills so that they can go back to the classroom. I think this is an advantage because traditionally when a student has escalated to a point, they're either stuck in a counselor's office or an administrator's office where, again, there's a lot going on, or they're sent home. And I think this gives an opportunity for students to be able to de-escalate, to regulate themselves, and then be able to go back to class.
And what they've told us here in the room and to me privately is they are not ready to execute the full $268,000 because they don't have, by June 1st their comment was, well, we can give it back. Well, I don't want you to give it back. I want you to spend it. It's got to go out. So the $90,000 is a for sure. They're ready for that assistance.
That was my comment as well, too, here is that, you know, normally schools, along with government, normally don't like to be interrupted, even if it's a good thing during that, you know, during that school year. It's challenging for them to quickly absorb changes that well within their school district. So what you're saying is that 250 or 268 is more of a 90 number would be more in line? I mean, I'm open to support it, but I was, you know, hesitant on the whole dollar amount and implementation, so.
I would put 90 there personally, and then we can use our federal funding. Do you want to say something, Meg?
Well, I was just going to say, I understand what you've said, that perhaps they're not ready to implement, but I wonder if between now and June 30th, Western Dubuque and Holy Family could purchase equipment. So the $90,000 would pay the staff for the Dubuque Community School District, and maybe there's an opportunity to add a little bit more to that 90 for purchasing some of the equipment. They might not have the rooms open yet, but they could at least get the equipment purchased between now and June.
Right. That would be another $29,000 for Western Dubuque and another $14,500 for Holy Family. So what does that get us to? 90 plus another 30 and another 13.
Yeah, Dawn will share those budgets.
30, or 130, excuse me.
What are you doing, Dawn?
Dawn is going to share those budgets
Well, yeah, I mean,
just to see what pieces were.
so 90,000 for the staff, Western Dubuque 29 for their room, Holy Family is 14.5. So if we total those,
43.5 onto the 90,000, so 130. What did I say? 43. 133.5. Social worker now. Did I do it right? I gotta get my calculator.
So these employees, whose employees are they going to be then? School employees, county employees, ECR?
They'll be school employees.
And
what's the number?
or contractors potentially, right? If their funding's only available between now and June 30th, I don't think they would issue full-time employee status and benefits.
I'm sure that the Dubuque Community School District is employing them because they have a plan for future to be able to sustain it.
So maybe it's already in place, we're just providing starter funding.
Yeah.
Okay.
And what is that number?
3 lines is 133,500.
So that's what I would propose putting into that, just 133,500.
Our first win, I'm comfortable with that number.
Charlie, are you good with those parameters? So going back to the main share?
Yep.
I want to make sure that we're getting money to entities that don't have the ability to tax and raise money.
Good point.
The school district can raise their money.
And that's why we're going back to this. So that's why we're going back to the spreadsheet. These are new positions that they have not had, and so the request is to assist them. And then they will be up and running. The rooms, for instance, are being funded through philanthropy.
Mm-hmm.
Those are not being paid for by taxing authority. So it's really presenting a complete new pilot program for them to get started with. If it works, fantastic, they'll take on ownership, and if it doesn't, then we have spent the funding into its highest purpose for children.
Okay.
So, where are we for total now that's left to spend?
$935,869.
Okay.
If, assuming that 133,500.
I would like to ask my colleagues to consider keeping some of the funding back, maybe $100,000. We are working with higher education. They're doing a training of trainers, all 7 campuses, and they're doing mental health first aid, which is a training program that teaches the staff, RAs, student life, what to look for, how to screen for brain health issues. And that is not something that the region has training funding for, and that is going to come in probably somewhere about $35,000, $40,000. If we hold back $100,000, we can be looking, I don't know if we ever got a good answer from Sunnycrest, our own Sunnycrest. Are there brain health pieces there that they should be looking at?
So that's a question to us. I would think you should ask and answer these first, and if there's money left over, we can go out to others, but I think we have spent time and energy, both the community and the presenters, and we need to ask and answer these first before we talk about things that are on the list. That's my personal opinion. At the end of the day, if you get a bunch of no's and there's funding left, then maybe you can go out, but, you know, I think our work is in front of us.
Well, I'm letting you know there's other work out there that's also being
every day,
worked on.
it never stops, yeah, so I've been doing,
These deadlines were our deadlines initially, and we've let a lot of folks go past those to get the projects that are before us.
Agreed.
So,
Yeah.
I'm just making you aware of that I don't wish to spend the full amount of money today, knowing that there's something quite valuable that will help our higher education institutions to succeed.
Good point. We've got $20 million behind us and another 60 applications that are waiting. So, you know, to add another one, great, but we've got tons of applications that we've asked the community to submit to us. I think we need to ask and answer those first. And that's what I'm focused on today.
So what is left in the funding requested when you remove the zeros? What do you have left that's still, if you would, do you understand what I'm asking you, Stella? The total remaining outstanding request, what does that total to?
About 200 grand, I think, roughly. We'll see. We were getting close.
$1,116,991
So the difference of that is,
Oh, is it, Stella?
$1,116,991.
what's the difference between that and the 935? That would give us your deficit.
About
180. 180, yeah. So you're 180 short. If if you feel comfortable with the other presentations, you're just 180 heavy.
I guess I'd like to, well, May is with us also, talk about the Hillcrest line 19, the Access MeCare platform expansion. That was funded by the region, and have they asked you to refund that? And there's something holding that up?
They have not added a formal request to the region for additional funding. I think they have, at the Regional Governing Board, we have not addressed it, no. We are, though, we had My Care Community that was active in Lynn County and Signify is the parent company for My Care Community. Signify notified Lynn County about 3 or 4 months ago that they were no longer going to support the My Care Community. So we had a resource and referral platform in Lynn County that was hampered by a lot of things, and now it's gone. And we have Unite Us, and we have Big Bertha, I think it's called, which is really a strange name for a resource and referral network, that are interested in establishing themselves in the region. So what I want to see is for us to do a pretty comprehensive evaluation, because we have a lot of different resource and referral platforms. Once again, from a brain health perspective, we haven't gotten a lot of benefit from them. They're a little bit more geared towards social determinants of health. I know the Access Me Care community has more of a brain health focus, but the other ones, historically, we haven't gotten that benefit. My Care community was sold to us that way. The region has invested over $350,000 in resource and referral platforms in the last 3 years, and I don't believe that we've gotten $350,000 worth out of them quite yet. And so I would like to have a study done to see which is the most effective one, which is the one that we should promote region-wide instead of having, different resource and referral platforms. And we're not there yet. We haven't had that evaluation done. We want to do it, working with a partner to be able to do that for us. So at this point, from a regional perspective, I'm not supporting any investment from a regional perspective, any investment in resource and referral platforms until we have a better look at what is going to be the best fit for us.
So one thing we could do is take item number 19, line item 19, and reduce it by the shortage of our balance right now, which is 113.
Yeah.
So if you take 180 out of their request, everyone else then is fully funded with their request. That's one simple way to look at this.
One other, I like your direction where you're heading. One of the concerns I had was on, whole dollar amounts that are big when we need to spend them quickly. And so the Dream Center, I definitely support their cause, I support their mission, I think it's good, but, $400,000 is a big dollar amount to implement in just a, 7-8 month period. And so possibly that could be one where you could trim back a little bit too. And so unfortunately we have to do that to some degree where we're still left, but that's another idea.
Well, we've not done that at the governing board level. We haven't done that. We have said, I'm just going to again use Lynn County. They were hiring individuals and the contract came forward and we just approved Lynn County hiring a person. Obviously that person's going to work for a year, so it's not prorated. Do you see what I'm saying? It's like, it's not a prorating. It's that person's a new hire. They need $96,000 to get a new hire on board. So you can look at this and say the need that we know their need is far greater. Their application to the federal, to the ARPA fund, is $926,000, something like that. So, they're actually scaling back to say, this is the amount of money we can absorb and spend for brain health. They've got that waiting list. They've got people in the midst of getting mental health training as well. They're actively on this, addressing all of the brain health needs that they see among their kiddos and their families by extension. So I don't think we should say, well, they can't really spend that. I think everyone who put this money up here very seriously thought they needed it and could spend it quickly. They know the perimeter by June 1st. May, if I'm wrong in any way, please, help us understand.
I think those are certainly questions that you could ask. Robert's here and he could probably speak to that if he thinks he could spend $400,000 specifically on brain health. My question would be, is that all brain health or is that just programming? And is that educational programming? Is that brain health programming? And I'm sorry I wasn't here. I think I was on jury duty the day that proposal was given to you guys. So I'm not sure, and I know Ann told me a little bit about it, but I haven't read it. So is there educational programming in there? Or $400,000 worth of brain health stuff?
Robert, do you want to try to answer that? Do you want to come to the podium and answer that?
First of all, Robert Kimball, Dubuque Dream Center, 1600 White Street. All right. So first of all, yes, from our perspective in the way we understand the brain health process, or not the brain health process, but from what the county was requesting, from our perspective, the entire $400,000 and the Dream Center model directly impacts brain health. And so while, yeah, some of our programming is focused on social emotional development and impacting the mental health of our kids through social emotional development as well, all of it is related and connected to brain health. So, yes. I mean, we can go back through the presentation. I can go through every point, but like you said, May, you weren't here, and our presentation connected everything we're doing to brain health.
Thank you, Robert. That satisfies me. Thank you very much. Appreciate you being here.
Thank you, Robert.
So, generally speaking, I would, if there is a deficit, I would rather support people and hands-on than technology. And so if we're having to dial back some technology and access me care, and/or, don't take offense to this, anyone who has an elevator out there, an elevator, that's where I'd look to cut, versus on, people that are actually providing those services.
Well, that would be my proposal, is to fully fund everyone who's here with their request, and then take that deficiency that we have. I mean, I'd like to hold some money for those programs that I know are going to be coming. If my colleagues choose not to do that, then we would simply fund what's here and take the deficit into the Access Me Care program. That would be a reduction to their request.
Supervisor McDonough, can I ask a question about the book funding and why there's just what the difference is between those two book fundings? Because are both of those brain health related? Because once again, if we're spending it out of Fund 10, it needs to be. If it's educational, that probably is not appropriate necessarily to come out of Fund 10. So there's two books, and so I just have a question about that.
The first book is the one that CARES Fund that you approved and has already happened.
Yep.
The costs in there are the translation to Marshallese and to Spanish and to reprint. Okay, another reprinting. They're going to move it just from kiddos in Dubuque out into the county. So the same book. And then the second one is the book that relates to the conversation about coming to school and being ready to learn. It's all the social emotional. It's in draft stages, so there wasn't much to show other than that's the idea, is to help build that connection and good brain health, social emotional learning with kiddos directly related to get to school. Come to school, be prepared, what happens when you're not there, how to interact with school. So
the Dubuque Community School District has at-risk dollars that they use for dropout prevention. That is about attendance, and so are they funding part of that project as well?
We didn't ask that. Shirley's letter addresses both of these in her letter of support to the community foundations. I don't know if you have that to share, Shirley Horseman's letter. But if you want to look at the budget for that, you can show the budget page again. It's the book funding immediately follows the brain health retreat room funding. The subtotal of the first book, the reissuance of the first book with the translation is $27,000, I believe. There we are. And then the second book, which is Be a Healthy You in School, so it's modeled very similarly. They're companion books. And that one is $31,000.
Majority of the costs are actually in the publication of the books for those hardcovers. So for me, the book it's interesting, it's appealing, it's who can say no to books? I thought it was kind of a stretch for mental health funding, but I'm not the expert, nor am I going to be at the regional meeting. So I'm kind of lukewarm on that. The dollar amount, considering where we're starting, is not huge.
Right.
But if we're running a deficit, I would go back to my previous comment related to investing in people and services versus auxiliary items.
This one, I don't think, May, I don't know that they presented it to you during CARES Act. They were focused on getting that first book up and out, and that was funded by the region. The second book is a companion, and it directly relates, and the quantity is much larger because that book would go out throughout the county.
And that book was targeted to what age groups roughly? Probably 7 and under, 5 and under, maybe even? K2 maybe? Yeah.
The first book was.
So one of the opportunities that we would have for additional funding is certainly, you know, we have in the past funded Dubuque County Early Childhood. They've been involved in this project as well, and so that'd be another funding opportunity.
They helped write them.
Exactly. Abigail Hart is one of the authors, the director of that program. So I think there's more opportunities to fund this. I think it's a good thing. But if we're looking to maybe make reductions in order to fit the other proposals in, this, for me, might be one where we'd look at. But it's, you know, we're kind of down to the end. If we make a few reductions, we have funding for the rest of the programs. I would state at this point, I'm not interested in holding any fund back and looking to get additional applications. We've got 60 left that we've asked the community to submit to us that we haven't even looked at and had public discussion on. I mean, we personally have looked at them, but there hasn't been any public discussion on it, and I think we should move forward to those.
So here is Shirley's letter to us in support of this. Well, she's got them both mixed here.
It's kind of like Mercy One, but don't get me wrong, I support this, just not in this funding pool.
Right. Well, if we pause a moment, we might be able to get May's opinion. Poor brain health may manifest as persistent feelings of sadness or hopelessness or suicidal thoughts. Our schools are working with students to counteract elevated levels of anxiety and effects of prolonged isolation. One of the effects is that children are not coming to school, and when they do come, they have significant outbursts and physical behaviors in the classroom. I know that that's something that Robert told us they're experiencing at the Dream Center as well. So the proposal to do the books, help every child in our community have a book that promotes being healthy, understanding how to build positive relationships with the schools and positive, healthy attendance habits. So it's an extension to that next issue. So that's, I mean, you could certainly read it if you want, but that's the companion book that they've come up with.
I don't disagree that it's needed. Certainly it's needed. But going back to Supervisor Potoff's concern of an entity that has taxing authority in the school district has dropout prevention funds that could possibly support an attendance book.
So then if we are wanting to maybe not fund the $31,000 for that book, but keep the $27,000 for the first book that you've already approved, seen, and
yes,
to get it into new hands?
Which is a fantastic idea for the first one.
Okay.
So up on our spreadsheet.
That's $1,000. So,
Pardon?
So well, she's 2,000. Sorry. So I mean, I love the translation component, but that's a very small part of their budget.
But they're also reprinting.
Right, and re-illustrating. There's an illustration fee in there.
Yeah,
some of
the
that
publication costs that I mentioned. Right. That's where all of it is.
And in there, they talked that some of that has already been paid for, so it's not up on the screen. But so Stella, where would we put that number then? So we're saying $27,000 for purposes of our rough sketch here. Putting that to line item.
Are you comfortable with that, Supervisor Potoff? Is that where you'd like to go?
We're talking about.
Yeah, the 27's already been approved, so yeah.
But published and printed.
So line item 14 then to be a 0. Is that what you're lending? That's what you're suggesting, May? I mean, we ultimately make that, but I think that she's saying there's other funding.
I'm at 0, if you're interested in my opinion.
And Harley, where are you on that?
0.
Okay.
So now what our deficit is, what we... Closer.
$1,058,908.
But you didn't change anything with Access Me Care. I know, because there hasn't been a decision on that, but
Without that-
100,000,
100,000, what, where's presented right here,
yes,
Another.
not quite.
150,
a little more,
150,000,
Oh, you're right.
150.
150-ish.
So we have to make another $150,000 cut.
I've been kind of questioning the elevator related to the Hillcrest. I've been to that facility, I see the need, but, you know, that, you invest in that elevator, and they'll pull the trigger on that, but there is no funding or plan for that second floor at this time.
Right.
And so it's the future, so I don't believe in the life of that elevator, that it won't be ever used, but at this moment, it will be put in there, and let's say it's done by July 1st, it will arrive to an empty location on the second floor, which gives hope to the second floor. This is just, we need other funding then and other things to happen in order for those funds to be beneficial short term.
So if we didn't fund the elevator, I actually was only going to fund it to equalize whatever funding we did to Mount Pleasant. It's an elevator, it's an elevator.
Well, I'll jump in there. Mount Pleasant has citizens, they have residents, they are actively using that elevator and will actively use it every day, right? Okay, so I would fully fund the Mount Pleasant elevator. So I think that's a difference for me. And so I'm not anti-elevator, I just am questioning an elevator that goes to a second floor that has no development or no hard plan today. There's a vision, it's open space.
I guess I look at it a little different. That is our access hub. It is, got approved. If we want this to succeed, we have to set them up to succeed. Making them come up with a plan and then trying to come up with funds for the elevator. We have the opportunity here to get the elevator in where they can utilize the second floor. This is our access hub. I think we need to back that to make this flourish, to make it work.
You know what, Harley, and I agree with you. And I heard Senator Pam Yocum walk around up there and say, get me a plan, get me a plan. You have this second floor that needs to be used. And I've asked Hillcrest that multiple times, what's the plan for the second floor? They're committed to nothing on the second floor. They were here before us. What are you going to do with the second floor? What are you doing with substance abuse disorder? Well, we don't know. We don't know. So they're not ready. Supervisor Wickham's comments about it are true. I want to help them too, but I can't make them be ready to be helped. And yet this funding has to be spent. So what we do with the elevator there, you know, I wondered if we didn't fund the full $100,000 if they were not going to do it. In the past, they have not always done with fund balance dollars what we've asked them to do.
It's definitely an investment in the future. So, I mean, it's an investment in the future. And so I'm not, like I said, not an anti-elevator. It's just a point of question. So I could go either way.
May, you said you wouldn't support anything with the Access Me Care until you had some study?
Mm-hmm. From a regional perspective, we won't be funding any resource and referral platforms, any of them, not just Access Me Care, but any of them until we have our study.
So basically, it's zero that out because you're not going to approve it.
If you approve it now and you boost them, and between what we've given them, which was $125,000, so then they have, you know, $357,000 worth of investment, and if that's enough to make them fully operational, that's okay, but I still don't know that that's the platform we're going to use. And maybe that influences our decision because they're fully funded and they've been able to expand, and so we say, okay. The problem is I can't convince necessarily those folks in Lynn County who are kind of on their own path because they're really connected. Their resource and referral platform, the My Care community, was connected with the hospitals as well as the Access Center and the providers. And so they kind of have their own path that they're going down right now too. So it's just a lot of unknown for me.
Would you please put up John Bellini's comment in chat? If Dubuque County wants to continue to support the Access Hub proposal, the Access Me Care proposal is the means to make this hub work.
After sitting back,
It's a separate issue. It's a completely separate issue.
The comment, you asked for it. So kind of looking back at this now and giving a little more perspective. So, you know, Hillcrest is our lead provider in Dubuque County. And so I would probably be looking to, you know, with the remaining components left for Hillcrest, fully support those. And cuts that I would be looking to make might be at the community foundation level. And so granted, they aren't a taxing authority, but they literally have more cash than Dubuque County does if you pull their balance sheet. And so they've done very well, you know, getting the community to participate in that fundraising. And so, you know, if we were looking to make cuts, I would be looking at potentially that first book that we put in there, and or maybe some of their other proposals that they indicated as far as the training fund for $37,000. You know, that's my opinion. Appreciate respect for that. And so that's kind of where I'm at, board. I'm addressing my comments to the board, trying to solve this. That's where I'm at for cuts.
What you're now funding is an elevator to nowhere. And as compared to training, which enhances our workforce, that's working with children in our community. Those are, and may you have training. These individuals don't have access to the training that the region provides because they don't have a contract with the region. And also the other one you're saying that the line number 16, May, you've said that's a beautiful pilot and you're probably going to pick it up and run with it if it works. So it's an opportunity to forever enhance infant care with brain health. So those are very good, very worthwhile projects.
Keep in mind, they're all good. I mean, they're all in front of me, and I didn't throw stones at anyone. So I said, you're all good. In fact, many of them I said, I'm very excited about funding this. And we will fund the majority of them by the time this day's through. But if we are trying to get to a number, that's what we do, and we get to do that in public with those in front of it. So, you know, if I had to make choices now after kind of thinking, I would cut that first book that we just put for $27,000 and keep moving on, making cuts in other areas. The elevator in Hillcrest, I'm more supportive of at this point. I think your comments, Supervisor Potoff, weigh on me that it gives them an opportunity to succeed at that second layer. And then, you know, related to brain health, mental health, it will be a state finance program in the future, correct? Well, the county's not funding it.
Well,
I'm talking overall, not the elevator, not Hillcrest.
I know, but the state doesn't, I mean.
What?
In the way that they can bill Medicaid?
I'm talking about the funding for our mental health budget.
Yeah, it'll be state funded, yeah. It'll still come through the region, it'll have to be approved by the region.
Great, but it's state funding, so the comment was back with Senator Pam Yocum and others, you know, it's kind of moving towards them, less county supervisors, because it was our tax levy, and now it's moving to the state. That puts more pressure on, you know, basically the state legislators. And if we fund the elevator, that gives them the hope to develop that second floor. So that's kind of why I'm at. You know, eventually we have to make cuts if for the proposal that we have. Some changes have to be made.
I think line item 15 and 16 should move forward with full funding. Those are critical needs.
Maybe, Harley, do you agree? If so, we can bring them in.
It's a training fund and,
engagement class?
For kiddos, infants, basically.
the 16 is for the parent.
The infants, right. Mm-hmm.
Who's the 15 for?
That's for mental health providers who need advanced specialized training to better work with the kids that they work with. So they are not regional mental health providers. They are private, like the Life Connections, Julie Home, Amy Crow Sunleaf, the individual providers who don't work with the region, like private practitioners as compared to public defenders, by very poor analogy. But we're saying they need additional training as well. They don't have access to the training fund that the region has. So that's getting our own workforce back sharper with better skills.
Okay, I could agree to that.
Put them in. I did hear, if we want to keep moving, I did hear consensus for the Dream Center after I kind of questioned some. So would we want to put that in as well?
Absolutely. I'm 100% behind the Dream Center. That is...
So essentially, if you say what you want to fund, there's
potential to change outcomes for a lot of people.
We need to move Mount Pleasant's elevator over. Will be their final piece. That's line 25.
I'm comfortable with that.
I'm comfortable with that.
The senior health care for NEIA 3, they've asked, their application to us was for $17,000, $17,700. When they were here, they talked about all the other things that they could do or they might do that they are doing in other areas, but they're not doing here. So that concerns me a bit. I mean, I wouldn't mind, we could be more than 17.7, but I'm not, 50 was just a round number that was thrown out without any support for that inside their application or their presentation. So I would move forward for line 26, I would make that to be 17.7. That's their application amount.
Okay. Or 25, I mean, you're,
25 is fine.
I think we have consensus on 25. We've supported a Riverview in the past, and we fund them through different mechanisms. I understand the region has funded Riverview, is that right? Or Fund 10 projects have been funded? Fund 10 projects, same thing we're doing here, so our wrong language. So I would be comfortable with their full funding application. I think I heard a yep from Supervisor Potoff.
Well, I'm there too, so
Okay, all
fully
three.
fund
Perfect.
them. It's not a year to make a cut, but it's likely that that funding level can't be sustained likely in the future.
Good.
Number 28 is St. Mark with their training, and that's a train the trainer.
Yeah.
That's a direct brain health.
Thought it was a good
project.
program. I would support that 25,000 as well.
I would support that.
308.
Catholic Charities, the jail entry program is phenomenal. Just absolutely phenomenal, what they do. I think that should be fully funded.
Harley, you're in law enforcement for many years. What's your thoughts?
I would be willing to fund that. We need people, well, Catholic Charities, you have Caprice Jones, you have several people trying to help people once they get out of the prison system to get them back into the community. That's definitely worthwhile investment, I feel.
Okay, good.
So am I reading this right, that there's 208 that we can still allocate?
We got three.
Yes, out of,
330.
Now, if we do the Hillcrest elevator, be down to 108.
And then you could put the 108. Is there a consensus to hold additional funding for higher education, $30,000 or not? That's Jay's position, is there is not. What do you feel about that? We certainly have had suicides on our, death by suicide on our higher education campuses, and we are a unique county in that we have 7 private higher education campuses.
Yeah.
And this would train people on all 7 of those campuses.
We don't have that application yet, right?
No, they're working on it, but it's my delay, I suppose, but it's something that I think is coming. She's getting her hard numbers put together.
How much do you need, 30,000? I guess I wouldn't have a problem with that unless it's something that you'd want to hold and just put right to the ARP funds.
That's the decision that I think you're making.
Well, that's what I'm asking is, what are your thoughts, Jay?
I mean, it sounds like a very good program. I very much wish I had reviewed it and seen it, and the public had reviewed it and seen it. That's the process we went through for everyone on the list here. And I would encourage them, because our American Rescue Funds are not done forever. They're going to run until 2026. Not necessarily maybe the application process, but so there'll be plenty of additional opportunities to see other good proposals. But we've already asked the community for, I don't know what the whole number is, 80 or 90 proposals. And I would like to use the funding we have that we've been told by May last time when I begged to make more, give us more time. I think your comment was, you need to move quickly. So unless that's changed,
We still have a June 30th deadline.
okay?
And the thing about it is, I mean, June 30th right now feels like a long ways away, but we need to give these providers the opportunity to implement. So, I mean,
Agreed. So I just don't see any strong reason to hold back these funds when we have tons of other funds and tons of other applications waiting.
Maybe higher education could come direct to the region as a training program too. It's certainly an unmet need.
I mean, we, just a couple of weeks ago, took City of Dubuque application and American Rescue Funds and jumped it right to the top for fiber on Southwest Arterial. So the board can see that proposal next week if they want, if that's what the board wants. I would advocate that. But anyway, I would draw down the funds. I'd put those funds to use. They're tax dollars that we've already taxed. They've been sitting around for years. Our fund balances have been large for my whole 6 years. It's time we put the funds to use.
We could put the Clark proposal before you next week.
That proposal would, if we would leave the extra 30,000 in for that, would it be a possibility that the ECR would pick that up like next year to train more people? Because obviously it'd be a continuing.
certainly something we would consider, yeah. I would just say, just adding my opinion, Supervisor Wickham, you said much earlier in the meeting that you would like to see the money invested in people versus technology. So if you were to reduce the Access Me Care allocation by $30,000 to allow that for people versus technology. I'm just sorry, I'm putting your words back at you.
I also said I fully supported Hillcrest initiatives because they're our lead provider too, so I've played both sides of the fence on that one. You know where I'm at.
We could have the Clark before you, next week. This will have to come to a final, well, this is gonna be consensus today. We will make the motion next week, but Clark's is not ready because it's with 7 campuses. It's, you know, you gotta wrangle some animals there, some cats. But, I think if they knew the deadline was next Monday or no, they'd be here.
I'd be willing to hold the 30,000 back for that. Put the rest in the Access Me Care platform.
We're down to 78. That look, is our work close to done?
So, that holds back $30,000. So what we would do if there, somebody wants to make a motion, or we'll just have consensus on this, we'll come back next week with a resolution that lists these items, so we have it as full action by the board.
I'm comfortable making a motion to move forward to create a resolution for the fiscal 22 funding requests for Fund 10 balances as projected on the screen here and recorded.
I will second
With
that.
the remaining balance of 30,000.
So we have consensus because we have a motion and a second. I think we should take time to be sure this is where we are and this is where we wish to be. First two are already funded and they are underway. Line 11 is jail entry fully funded. 12, brain health retreat rooms funded for staff and technology and resources for 2 in the county. Holy Family, 1 in the county. Funding for the book to be translated, the CARES Act funding book to be translated and republished.
I guess just a question, Ann, on the, that training fund. So the community foundation's gonna have that, and if somebody wants to go to training, they have to go to the community foundation?
They're gonna be they're gonna handle the scholarshiping of it. Nothing will exceed $1,000. But it's basically your continuing ed, the tuition and some travel.
Okay.
That's exactly what Lynn's County is doing, or excuse me, Jones County. I got the idea from Lucia, yeah. The infant project is going to be very interesting to see that get going. The Dream Center is full funding. Access Me Care has some funding to continue their programming. Elevator with their updated numbers for Hillcrest. Mount Pleasant Home fully funded for the elevator. Senior Brain Health from NEIA 3 to continue those membership fees and a small increase. Riverview fully funded, and St. Mark's with their new program for brain health fully funded. So we have a motion and a second that these will be our funding and retaining $30,000 for a yet unnamed program. All in favor, say aye.
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 Aye. That motion carries. So this will be back in resolution form in
Good
May.
work, all.
You've got it on the agenda.
And, ask me the question that I want to make sure that you guys know that we will do a contract with each of these providers from the region. Because it has to, all of these projects have to be approved by the regional governing board. So then there's a contract that will be done so that all of this will move forward.
Wonderful.
Thank you, May.
Yes. Or not? I think,
I think we're done.
yeah, I think we're done, actually. So, I'd look for a motion to recess, a brief recess.
I'll make a motion to recess for 5 minutes.
I will second.
Motion and second to recess for 5 minutes. All in favor, say aye.
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 Two elevators, 2 hours.
Good conversation, Harlan. Session? Okay, we are back in session, and the next work session concerns that this is a general update on funding applications, on our other funding applications and programs, including discussion of a purchase service contract that Stella has prepared, the auditor has reviewed, and we do not yet have the county attorney's comments on this. Is that right, Stella?
Correct.
Okay. And we also are expecting to have some review of the community survey, and then conversation about any kind of, it says application scoring process, but the idea was, is there anything that our executive team can do to help us get through the amount of applications we have? How do we want to start categorizing funding requests? And we have a team that will help us with all of that, but they're not sure if we want them to do things or not things, or, you know, so I think that's why we decided to have some general discussion.
So one of the things we talked about after we got through the mental health funding discussion, which we just did today, was to pick up the group of applications that applied under our Purchase of Service program last December, and that also reapplied for American Rescue Plan Act funding or any of this funding, and look at that group again, because they have been waiting for some time now. So that is our plan, is to kind of look at that group next and work through those applications. Next week, I think we'll have the Food Policy Council on the agenda to review that funding and application and contracts for that group. They've also been waiting on an answer under this revised program structure. So we'll look at that. We'll look at, like I said, the Purchase of Service group.
I invited CSCI, so EICA's sub. They handle the coordinated entry program. I've invited them to come forward next Thursday as well. they're a Purchase of Services vendor. They applied last December, and they're, like everybody else, they have an increased need, so they're asking us to consider additional funding beyond what they had originally asked for. But that is one that I have asked to come forward to begin the conversation for purchase services. They can make a presentation, and we can begin that discussion.
Yeah. One of the things, likely Ed will be starting to lead the discussion regarding purchase of services. I'll be kind of switching gears a little bit here to focus on FY23 budget. As I saw Jay just looking at the calendar, we have not many meetings left between now and the first of the year when we really start to focus in on our budget work session. So, like we said, the 22nd, you've invited CSEI. We'll look at Food Policy Council. The 29th is our night meeting, so we typically don't have work sessions on that meeting.
Supervisor McDonough, the group, too many acronyms too quick for a Monday.
Right.
The group that you invited, do they have an application in front of us?
Yeah, they do.
So they have one. So maybe the question for the board, since we're talking about this, what process do we want? Because I certainly could invite others that also are saying, where's my funding? Do we want it to be just supervisor driven, that we just, whenever we think we want them to go on, we get on? I'm just, we've just got a big list, and just, saying, I want you to come to the meeting, and now you get time. Is that how we want to proceed? Just a question. I mean, I know you're responding to the community need, but there are many of those requests.
Well, I guess there's...
Literally 50, if not 75.
There are some that could come next on the 22nd that are, I don't know, we've already approved Greater Dubuque Development Corporation. They don't know if they got to come back, or what are we doing? We've got to approve a contract that we're asking them to sign. So there are several like that. We have ECIA membership like that. I mean, I think one thing would be better is if we give our staff some latitude to group things and say, this is how we categorize these. These are how we categorize these. There's some very small requests that could be done quite quickly that are from, again, things from the Purchase of Services program that's been held up since last October, December.
So
November,
I agree, that's where we're at. And so just adding people to the agenda at each of our own discretions may not make that a streamlined process. And so how do we want to move forward? So if that's the question, my first comment would be not to just individually, each supervisor, grab people and put them on the agenda. I think that will cause confusion. Thoughts?
I would think that if we're going to let some people come, everybody should have the opportunity. It's my personal feeling, and I've said that before. If we're gonna let one group come in, everybody should have that chance. Everybody should have a level playing field. And
But I
if
think
they don't wanna
everyone-
come in, that's one thing, but
I think everyone's going to. Nobody's saying no one's not coming in, right? Is anybody feeling that people shouldn't come in?
I actually was, but only by virtue of that some of these should just be funded. They won't require taking time out of people's schedule and time out of the board's schedule, that there are a fair amount that clearly meet the guidelines of ARP, clearly serve a good public purpose for the county, that I think with some guidance from our team, the board should be able to fairly cut and dry, wipe out a small to medium, large size swath of those applicants.
And a lot
That
of
would
these
save
are
everybody
funded
time.
today.
Correct. But, so I'm not suggesting we don't give everybody their day in court, so to speak, but
all these people had their day in front of us.
but that there may be instances, and certainly are instances, in my opinion, where the board could just fund and not have to have those groups make proposals. That would also
Right,
fit in
right.
with timeframes that, and time crunches we're working with.
I would support that, and so, if there's a group that's gonna review those and propose those to us, I'd be open to it. I think that's a better process. We basically said, okay, let's do fund 10 projects first. We agreed that. We're kind of done with that. We're dang close. Got maybe one more day of that, one more hour. And so now what's next is kind of what you're asking. But what I don't wanna do is just randomly start bringing people in. And so.
Well, I think that's where our group could be of value. We can,
What would you propose?
the four of us to be the,
Organizer?
to a degree, yes.
Yeah.
I mean, obviously, there'll be times where one or all three of you will say no or yes, or let's do something a little bit differently. But to be able to put the structure into place and to be able to say, hey, we've identified, here's 10 that we think really require no introduction. They should just sail right through. And then that would be what we would address on day X. And then on day Y, here we've got 5 more that fall into this category that we've designed. There's no follow-up with their applications required, so we'd like the board to consider funding for these. And then we just work through it in that way. That way, the three of you are remaining objective to all three. Nobody really has a complaint that one or the other is throwing stuff on the agenda. And you've got 4 of your most talented employees all in this room who can help get this process moved along for all of you and the county. We need results for people,
Sorry,
No.
that's my brain just
I didn't
jumped.
hear it.
No, I thank you. You said 4, there's 5 staff members left. I think I think if your group feels you're close enough and has that expertise, I would value that service and,
I would ask the rest of the group to weigh in just to make sure I'm not speaking out of line for all 4 of us.
I'd like to see next
Is
week.
it Ed or Ann? I guess I'm confused yet. It's Ann, okay.
So Ann's not involved in this process. She's not in the team, right?
one of the 4 best, okay.
I meant on the
He's answering
group.
that question.
Ed and
Next
Ann
question,
are-
who's on the review committee that Kevin's kind of defined?
The group has been, Kevin, Dawn, myself, and Ed.
Okay.
And you guys are overarching departments and obviously elected officials.
And I would like to see on the 22nd, some of these small organizational groups be completed. Start to clear some of these that are,
Maybe we can bring up the list and have an example that might help us all to say, yeah, that sounds good. So when I hear small organizational, I support that. I'm just not sure what that is.
I mean, to a degree, I don't want to be half pregnant about this. If the board is going to decide that the group of 4 individuals is going to categorize and present asks as we see fit, then that's what we're going to do. I don't want to switch gears halfway through into something else because we may not be meeting every expectation of the board.
I think that's fair. Just, okay, keep in mind, runs till 2026.
Mm-hmm.
So this first batch of applications, I would assume we're not going to shoot out 20 million because we don't have 20 million.
Correct.
But we're also hoping we'll get the next 9.5 million, so to speak, to come in, which means we'll have another process that will occur.
Right.
So maybe within the next 6 months or so, or 3 months, I would agree with you, Kevin, that would make sense. But know that there's another day where something else has to happen.
but there are some groups that we do not want to be federal subcontractors. We want them to be under the purchase services and funded by our general balance.
Most likely.
Right.
Most
So
likely.
those you can know because between the auditor and the budget director, you know who you don't want out there worrying about whether or not they've complied with the federal requirements.
Correct. I think that's what puts this group in the unique position to be able to make some of
Right.
those decisions to
Right.
assist the board.
Right.
And I will say recommendations and proposals. We need to make, in my opinion, be the one to be front-facing with the public on here's the decision.
Oh, absolutely.
And certainly, tell them here's the process too. Here's the process.
I think in some cases, again, that project can be short-circuited. That process can be short-circuited in some cases.
It happens in government all the time.
Yeah.
So, yeah, I'm not advocating for that, but yeah, I'm aware of it.
I would like to have CSEI come next week.
I
They
would
have a
not.
budget.
I've got a list of 3 or 4. I'd like to bring 2, and Harley might have 3 or 4 as well. I think
Put them on the table now and invite them.
well, I think that's we're just circumventing the process. I mean, we've got, how many applications we have? We have 60 left, internally and externally? Now that we've gotten these 15 there?
Share.
If each supervisor cherry picks their best one, or the one that keeps calling them, that's not a good government process, in my opinion.
Got a big unwieldy spreadsheet that's not great for projecting up here, but
Right, what we need is to know which of these are from the purchase of services, because they're the ones that have been hanging around for a year.
Yep. So I've taken all of the remaining applications, and added in a column of how they have applied. So really what we're kind of looking at is some of these ones that have done purchase of service prior, in December of last year. So that's the group that we want to filter out and start looking
Can you
at.
screen for this right now and create a spreadsheet for us to see that says purchase of services?
I had a question in first. What's the total number? Can we just start with that? What's the total number we're dealing with?
Sure.
Just to give us some context. So that goes to my point, when we start bringing people in one by one, we have 115, some of them are multiple departments.
57 million.
Are these also our county departments?
Yes, this
Okay,
is
so
everything.
this is everything.
Yeah.
So let's look at the purchase of services and see what we have.
But maybe back to Supervisor Potoff, I mean, do you support bringing in, each one of us recommending and bringing in our identified organization to speak with us and meet?
I wouldn't agree with that.
Okay, so I think you have consensus, Supervisor McDonough.
I have them on the agenda for next week.
I think you have consensus from the board, and if we need to go to approving the agenda before meetings, we'll have to. We've never had to do that.
Then we might need to do that.
Oh, come on.
Because the reality is that these people have an issue they want to talk to you about.
Multiple issues that I fielded, and I didn't bring them to the Board of Supervisors.
This concerns homelessness in our county.
Supervisor McDonough, are we going to go to where the board has to approve the agenda? We
I
can't
am the chair of the board, and if the chair wishes to bring somebody forward, I don't have a problem with that at all. I'm not bringing forth 6. I'm not cherry picking. This group has, working with our homeless population, and they wish to be in to address us. If you read their application, it is screaming with issues that need to be resolved.
I don't doubt that, and there's 114 on the list that also said they're worthy, and that's why they sent us applications. I don't doubt that they're a great organization, have needs. I'm just saying the process to put them right at the top of the list in front of the board is not a good government process. The board, the consensus of the board moves the board forward. Agreed, Supervisor Potoff?
If we could look at the purchase of services and see what we're actually talking about.
I'm talking to my colleague. I'm asking a question to my colleague. This is a Board of Supervisor meeting. The Board of Supervisors should be able to discuss freely. How would you like to proceed, Supervisor Potoff? You clearly heard me that I don't think we should just add these items in an ununiformed manner at the discretion of each supervisor. That's what I would not want to do.
I would have to agree with you that we don't want to be cherry picking ones out, and I brought that up several times now, that everybody gets an opportunity or nobody does. You said everybody's going to get the opportunity. Well, then, that's fine. But I think we should be saying, okay, who's going to come in this week and whatever. But I don't like the cherry picking thing. I just want everybody to be on the level playing field. We got $60 million in requests for $9 million.
Certainly I'm not cherry picking. I'm asking us here early, before whatever else unrolls over the next 5 weeks. Somebody who has an urgent request about an urgent need. We won't fund them next week. They're not expecting to be funded next week. Somebody has to go first.
I understand that.
And we're talking about the process that the auditor recommended was not the supervisors determine who goes first.
Well, but just to be clear, the precedent set forth in our county thus far has been that if the chair wished to have something on the agenda, that was placed on the agenda. And I would caution everybody about making decisions that would then affect you in the future. Because if you're the chair of the board, you would expect to be able to put something on the agenda as well.
Agreed. At the same time, the board functions as a consensus, and we've never had to approve, and some boards approve the agenda before they move the meeting.
That is true.
And so, you know, if we want to get to that level, we will. And what you're hearing is two supervisors saying, no, we don't want to start meeting individual applicants tomorrow.
And all I'm stating is that there's always been some latitude given to the chair in this county.
Agreed, but we've never... And it's interesting that I am the supervisor who's the chair, and I'm asking to bring somebody forward. They've been waiting for 3 or 4 weeks for this.
They've all been waiting. They've all been waiting, Supervisor.
By your vote, sir. By your vote.
I agree. They've all been waiting. And
I
so for you
intend to bring forward CSEI.
I love your stubbornness. Awesome.
Right. So,
well, I will move to put on the agenda to then next week, I'll have approval of the agenda as part of our normal agenda process then. And so that will be, and the board will determine if they want to structure it. Supervisor McDonough, you've already delayed the mental health because you have one more proposal from Clark University, by the way, which you're on that board, and you're going to bring that forward.
Campuses.
You're bringing that forward, and the board gave you latitude.
You work for, sir. So let's just be clear about cherry picking is weird in this context.
It's your proposal. I have nothing to do with it. I don't even know it. And now you want another one of your persons that you have direct contact with to jump to the top of the list and be the first to present. Come on.
They contact me as the chair.
I agree. Let's do a process. Let's let staff organize these and bring them to us, or we'll have chaos.
We're going to give everybody the opportunity to present.
Right.
Somebody does have to go first. Okay, if it's this one, that's fine. But I think from this point, then our committee decides who comes in what order. Just to be fair, that there's no, I like this one better, or I'm involved in this one, or whatever. I think it has to be a level playing field. I don't want to show favoritism to anybody. I want to be fair to everybody.
There isn't favoritism, Harley. I don't know how you can see that.
And I know that.
Right.
Those in first in line that get to ask for funds,
I'm just saying,
and they're chosen by the chair to be first in line, I would say that's selected.
Funding will be done at the same time. I don't imagine we'll issue any funding for weeks and weeks and weeks. Could we go back to the process that our team has put forth? This paralyzes them with not knowing what to do, by the way.
Well, that's because we randomly pull
They
people
know
up.
that I've asked to bring CSEI forward. I've talked to each of you about that on more than one occasion. No one's pushed back and said, oh, that's cherry picking.
Well, that's because it's the Board of Supervisors that makes decisions, not staff. And so you're hearing from our colleagues very strongly, and you're ignoring it.
Are we ready to talk about what's being screen shared?
yes.
Stella, are those purchase of services, or have you?
Sure. I've filtered out everything except purchase of service. So in that third column, you can see if they applied for purchase of service last year and again to American Rescue Plan Act or not. And if they revised their proposal, that's the column I've highlighted. So many of them did revise their proposal.
How many are there? So the gray shaded column to the far is what we're talking about,
28.
correct?
Right?
28 count, yep.
So there's 28.
28 for 4 million, 4.4 million.
4.4 million.
But they didn't originally apply. Every child reads that wasn't originally a purchase of service request.
Yes, it was. Yes.
Okay, here it is.
Yes.
AmeriCorps, was that on here originally?
Yes.
Did it have a different name? RSVP?
A lot of them look very familiar, so I mean.
So the first ones we'll probably pick out would be the things that are, maybe a dues type situation, ECIA. Their funding, that is kind of a dues situation for being part of that organization. Those are kind of simple things to look at.
So is Macokota Watershed?
So we'll pull those things first and then, kind of work our way through this list. So that this is the next kind of group that we want to tackle.
Right.
That's what, this group is proposing to the board.
And line number 42 is CSEI.
Correct.
So if this proposal of allowing our group of 4 individuals to sort of move forward in this fashion is how the board would like to see it go, I would like to get some sort of formal directive so that we have, so we know we're not going to get turned around 3 weeks from now if there's a disagreement, so.
I think that would be wise. I would like a process, and I'm happy with the process you've generally verbally outlined. How do my colleagues feel?
I'm happy with the process. They have them go through these, ones that obviously you think are, whatever.
Could you do a one-page summary?
Come in, you set it up.
If you could do a small paragraph summary of the kind of the general process we're doing so that we're, sometimes verbal is difficult. I would put too much work on it, but I think that would be helpful for us to review.
If we can do a couple things at the same time, we might also think about bringing forward.
Maybe we do have consensus, but Supervisor McDonough, do you agree with having that group of 4 work on that process? Is that something that you'd support?
Yes.
And we're more than.
I've been asking them to do that, and they say to me, they're not sure, but there's consensus. So thank you, Jay, for bringing that up.
Yeah, you need to talk to us. That's how we know what we're doing, is you share that information with your supervisors, because I don't read their brains.
So,
we're certainly capable of doing more than one thing at one time.
I think so.
Many years.
We had 2 things today that we said we would refer to ARPA. And I would like to be getting ready to bring forward that Mobile 1 unit. That we had I think there was consensus to support. It's just that now if we don't bring it forward soon, it will be lost in our budget sequence, right? So let's try to bring that one forward. They just presented to us.
Maybe a question of all of them. So that's one. What happens to all the other ones that were not funded?
So, I noted next to all of them, I think, that they would be referred back down to American Rescue Plan Act when we start discussing those in detail of how we want to spend that funding. One of the things I think we need to acknowledge and think about is that many of those projects, I would say, probably would start funding July 1st, based on contracting and the funding cycle. So I just wanted to think about it in that way.
But the concept of the ones that we didn't fund today don't get thrown out.
No.
They go to this list.
They go back.
Including the Mercy one.
Yes.
So awesome. Good.
Yes.
There's no reason to delay Mercy 1. What would be the reason to not bring forth Mercy 1 for ARPA funding quickly? In the first week of December, what would be the reason to not do that?
For me, I would like to answer the question, because we're the ones that provide the answers to that and have the authority, is that maybe why not bring Fountain of Youth right away? Why not bring Dyersville right away? Why not bring Creative Adventure right away? There needs to be some sort of vetting and organization, and it can't be just one supervisor's prerogative. It needs to be consensus of the supervisors of how to move forward.
Thank you for the instruction. The reality is that we've talked about Mercy 1's mobile unit. We talked about it today. They've been before us. That's why I'm asking, can it come forward quickly? Or do we need to go and...
Sorry.
Go ahead. I mean...
They're not actually ready to deploy yet.
They are deployed.
The mobile?
Mm-hmm. They're doing vaccinations all over the city for kids.
Yeah, it is on the road.
Mayor-elect Kavanaugh's children were vaccinated on the Mobile 1 unit.
Maybe let me help. Should we take the rest of the mental health Fund 10 and now say yes, no, or in between? that could be a process, because I agree with you. We've just reviewed them. They're in front of us. It's fresh in our minds. So, you know, pushing them another 3 months off might not make sense. They're fresh in our minds, but I don't want to pick just one. I'd like to get the list, and it could be no, and they're done, or it could be yes, and they're funded.
Right here, the list, test it out.
I agree. So I'm asking a question, would you like to do that? Our next batch could be the ones that we just didn't fund for Fund 10, but you heard comments that we were supportive of, and then make final decisions on those.
There are two
No, we
here.
did, how many we did?
It said that we would refer forward.
Well, I would say refer all of them to my proposal process, review all of them. And if one's up there and we go, no, it's no, 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 then they're done. But yes, they're funded and could be, you know, in between related to dollar amounts.
Is it the,
And then we're up, then that list is done.
is it the goal of the board to fund these as they're hearing them, or to hear all of these and then fund? Because it doesn't really, it renders the decision, the topic of conversation moot. If you're not intending to fund until after you've heard everybody, then it doesn't really.
Here's my thought. Like the Take Care Center, that needs to be completely vetted. I don't know what the number is. Ann doesn't know what the number is. The number changes, the structure changes. That needs to be vetted by somebody to say, what is it? What's the actual number?
Yeah, I mean, we could put the mobile unit as a recommendation to talk about it next week. But if the board is not going to award any funds out of ARPA for anything on this list until everybody's been heard, doesn't really matter when we hear them then.
Good question. So we did, you know, that's how the mental health components, we heard them all before we funded, and then we had this final day.
I personally, I would advise against waiting until the end.
I think it's going to be very hard.
There are others that I would strongly consider us as a team with our skill set, pulling them together to be looked at. There are, I think, at least 5 projects that directly relate to workforce development issues.
But I guess, just to ask my question again, if we came forth with 5 or 6 people to hear next week, and the board agreed that 2 of them were good and they wanted to fund them, would you be allocating those funds at that point to those groups?
I would want us to go through and see whether or not they should be working together, right? So Steeple Square issued a request, and NICC has the same request, same program. They want 400 grand, this one's 300. It's the same program. It's literally, they're the partners to each other, and they're each asking us to fund them individually.
You're talking about applications. I want to talk about the process.
This is process, and I'm saying, to me, that makes sense to have the team say, those should be grouped together to see, are they all working together?
I think that's what our group can help do, though. I think our group can identify common denominators.
But your question is whether we would delay funding until we've heard many or all the applications.
At the end of the day, that's kind of the most important question to know.
I agree.
Yeah.
I'm waiting for the answer to one of my colleagues.
If you guys have St. Mark come in here next week and they do their pitch for their Hero Summer Academy, and it knocks all of your socks off, will you be funding it next week? Or are you going to wait until you hear from Dyersville and ECI?
My opinion is you fund in shorter increments and more responsive increments. You do not wait. And so whether that's the day of the presentation or the next week to let it sit for just a little bit, that's where I'm at. I do not want to wait till we've gone over all of them. I prefer shorter. That's where I'm at.
And then if our group is putting together a list of initiatives that we've identified that meet all the needs, that the applications are good, and we were to present those to the board and say, here, we've got $70,000 that covers 12 asks.
And that might be the next week type of thing. I like that.
Would that be something the board would be willing to fund at that point then?
I would think we need to move on some of these nonprofits. They've been waiting since July to get their funds. I think we need to move to get these people their money.
We can take this information.
Yeah, I know Mercy, you know, they're moving, but I think these nonprofits right now are a little more important than Mercy.
Because the answer to this question may change the calculus.
And CSEI is one of those nonprofits.
Whoever's last. You never want to go last.
Right?
No, but to run out of money.
I did it right away.
Yes,
That's part of ECIA. That's my understanding. But anyway, these
on their board there.
These smaller ones, I think we need to.
Because if the board is going to award funds as we move along, then yes, we certainly want to get the people who have been outstanding, the people that have been waiting for answers, the people that are emailing and calling all of us probably at the same time.
I'm ready to make funding decisions very short term, if not the same meeting, the next following meeting. That's where I'm at.
I would say many of these that are presented,
I'm fine. I'm just, you guys need more information? You know where I'm at. Where are you guys at?
I'm learning.
Okay, that's fine.
It's a long list, and I think you need to hear everybody's story, but at least go through. And I've been going through their applications. I've been a little busy. I'm not through all of them yet. To have a little bit of a grasp on it.
Yeah, I would agree.
You know, it's hard to get 60 million in request and $9 million. Okay, we got 19 million, but we don't have the other half yet either. So it's kind of hard to say, okay, well, this is a good idea, but geez, they're asking for how much? You know, it's difficult. It's going to be very difficult.
I think we should let our team organize something, and then we can tweak what you bring us something, and then we'll know whether or not it works, or we want you to tweak it.
I mean, the three of you can always ignore everything we say, so, I mean, if you at least give us a shot here to put this together in an organized fashion and present it, you know, we've got all different corners of the spectrum here, so we can look at it 4 different objective ways, which will help the three of you, I think, in the end, make the decisions you need to make.
And then, the purchase of services contract, Kevin, you're good with it? And we just need to get CJ to weigh in on it, and you've got it ready so it can be in short order reconfigured for any decision that's made, right? Is this the same that you intend to use for ARPA?
no. So that would be used for anything that's our traditional purchase of service within the county. But when we're looking at the federal funding and the additional requirements that will be part of that, any kind of pass-through on the federal funding will need a more expensive contract.
Can you give us a sample of that for next week?
I don't have that drafted yet, but I will, that's the next step.
Will you have it for next week?
Probably not, but,
That's gonna take some time to put together.
It won't matter if we're not funding them for another 3 to 6 months.
yeah, I would think those need to be
I
in
don't
order
propose.
first.
Well, but here's the example.
Versions too, correct?
If you bring forth something, so let's go back to the Mercy example. Mercy's going to be funded by the federal funds, most likely if it's funded. What would be the purpose of bringing them forward if we don't have a contract for them to sign? Right? So, I mean, the work behind the scenes has to step up too. We have to get the contracts ready to go so that we're ready. It's not just whether or not we want to make decisions, it's whether or not we're ready to make decisions with the contract.
Agreed.
I believe, though, that the idea here was that some of the purchase of services that we'd be presenting to you would be not paid out under ARPA.
Yeah, what I was going to say earlier is that many of these small amounts on here would better fit under our general basic funding, like we've traditionally done, and that can clean up this list significantly to really focus in on what we're going to do with the American Rescue Plan.
And CSEI, again, go back to that. Some folks, I'm sure, are tired of hearing that one. That's an example of where they came in as a $25,000 simple request under purchase of services, but their need relating to homelessness is greater.
Yeah.
And they even have additional things in their extended contract that might go to federal funding.
Yeah, so that one, to me, is not a simple, let's look at this under general basic funding. That one clearly, with the increased request, would go under the scrutiny of the American Rescue Plan Act.
And so when are we going to do that? Because
that would be the next group after this.
Yep. They're going to have to, I mean, their budget's underwater.
I think one of the important things to consider, even if it's 10 or 25,000, that, you know, general basic dollars are local property tax dollars. And obviously the ARPA funds are federal, of which our taxpayers' percentage is very, very small that they paid. And so I'll go back to that. If the coupling of a bunch of these programs is significant, I really think we should do our best with guidance to get these through American Rescue Fund planning. Because the federal government has a lot more money than we do, and our general basic dollars are precious.
So then CSEI is not going to be able to come forward because we don't have any hope to fund them through the federal program at this time. So when will we be ready to do that?
So I would anticipate funding under rescue plan with our new budget July 1st. Anything would start under that.
So that's,
But decisions,
Decisions could be made at any point.
okay.
But
So,
contracting to start program work July 1st.
wait. So
that's quite a long delay.
high level, I would see us working on non-internal applications over the next 60 days, okay, into January. Hopefully getting through all of them for American Rescue Funds and having contracts approved, hopefully, you know, the list. And then during our normal budget time, an idea I have is that when we have conservation, IT, whoever in front of us for our budget time, we use that moment also to talk about their rescue funding applications, make those decisions at the same time. And so that we can, hypothetically, by the end of March, have at least the first go-around. I'm not saying they all get funded or they all don't get funded, but at least the go-around, everyone has had their application reviewed, heard, and gone through. So I don't know if that's too ambitious, but that's what I would be, that's one process I've thought of.
When we say we're not going to make any funding requests from the federal funds until July 1st, nothing's going to be paid out till July 1st, that's a problem.
That's a problem because we'll be a year behind for a lot of
them.
smaller entities that we've
For some
helped.
of these smaller ones, though, that Supervisor Wickham indicated that if they get lumped together, they should go towards ARPA. We still do have funds that were allocated by the board to be spent as purchase of services for this fiscal year. I mean, the simplest answer is the easiest answer is the simplest answer here. And it's the correct answer is that you lump the ones that you can together and you already have it budgeted and you pay it. You pay them out. You get it done and we don't have to do them under ARPA. We're reducing a lot of the smaller dollar asks to,
Going to prevent.
that are going through
Right.
ARPA.
But it's going to make a big problem for some that have a need, and we're saying they are too big for their request exceeds what we would do through purchase of services.
I think there are always exceptions to a rule.
Well then, do I bring forth CFCI on Monday or not? I'm asking,
Well, you
when
heard
will the
from
federal
your
contract
colleagues,
be ready?
no. You heard from your colleagues, no. You think that would carry the most weight.
I mean, we can give each of you a golden buzzer if you'd like, and you
Yes.
can pick one out of, that you like, you know.
I'm sorry, what, Kevin?
No, never mind.
I've never disputed the consensus and majority of this board, and that's what you're doing. You've heard from your colleagues.
I'm in active conversation with the people who know what I'm talking about, the situation that organization finds itself in. That's what I'm doing. I'm trying to work on an issue that relates to homelessness population, our coordinated entry program with one of our most significant partners, ECIA, and that's what I'm trying to work on. And I understand that you want to have as a chair not have the ability to do that, and that I'm trying to find the answer that makes to me the most sense in terms of how does it affect the people in the county.
And you don't
What
like
does
your
this mean?
colleagues' answers.
I think you're glib in that. Don't do that, don't do that, don't do that, don't do that. Well, I work on this all day long. This is a 40-hour week job for me. So when people talk to me about issues, it really is about what's happening in the community. And so when I look, and I'm not looking at you because these are the folks that know what I'm talking about. I don't know that you do. So they have a upside-down budget problem that's going to impact whether or not people can get services through the coordinated entry program. That's a big deal. That decides whether or not somebody goes to a shelter. That's small, but it doesn't fit for federal. So I don't understand when Stella, can we expect to have the federal contract ready for somebody like this to sign? It's ECIA. They know how to do federal work. They know how to do these things. I don't understand what the holdup is from the background position about when we can get this federal contract ready.
We have not prepared the federal contract yet. We have not worked with our county attorney on that. There's a lot of reporting and monitoring that we still don't know what it is. So I would not recommend executing contracts until we know what is going to be required from the federal government from these entities.
Okay.
And so that's why July 1st, we should have all of that information, be able to draft contracts, be able to budget, and have this ready to go.
So what I hear you saying is that anyone who's seeking funding from the rescue plan dollars, the federal rescue plan dollars, none of those fundings will hit the streets until after July 1st.
That's what I would propose,
Okay,
yes.
so that resets, people need to hear that.
That's proposing. I would look to
People
get.
need to hear that so that they can reset their
Not
clock.
no, that's not gospel. What Stella Rundy says at the podium is not the decision. It's a proposal. The decision comes from this board, okay? So that's where you keep mixing up. Just because staff says this is how it is, that's, the final answer is here. I would propose we push, as I mentioned, sooner, and we get those contracts available, say, April 1st.
The issue with that is that if we don't have full final guidance from the U.S. Treasury talking about reporting and what's required of us on our end, we're opening ourselves up to issues if we don't know completely what to do. I get it.
You got 4 months, okay, so agreed.
No, we don't have 4 months. We're waiting for that, though.
But then the reality is that all the community saying, oh, the supervisors aren't organized, we don't know what we're doing, you don't have anything done. The reality is that we're not ready to do anything. We are not ready to issue relief funds under the federal contract. The city seems to be doing it, but we are not. We are not ready to do that. Is that what I understand you to say? So then it's not on me, it's not whether or not I get the meeting super uber organized or you bring forth anybody, even if you wanted to cherry pick. The reality is until July 1, your recommendation is we do nothing to send out any of the federal relief funds.
I would recommend that we review and contract and be ready to start all programming at that point. If you would like to move that forward, we'll push to get what we need by a different date.
Is the city sending out federal money?
I don't know what the city is doing.
I don't believe they have at this point, but I can check and verify that for you.
We've been early on this as a government.
We've been one of
We are one of the leading counties
We've been
in the
early,
state of
so,
Iowa.
and we've done a tremendous job. And so we have 4 months. My target date would be closer to April 1, and we try to move to that. That's what I would like to see. If it takes July 1, it takes July 1, but I would like to try to accelerate this process because we've engaged the community early and often with good intentions. And so to try to speed that process up and do reviews, organizations, contracts, and then awards in March and sign the contracts and execute them roughly April 1. That's kind of the general timeframe I would be interested in.
And I would add, we're ready to move on purchase of service at any point.
And do that as well.
And that starts Tuesday, that starts next Monday,
That would be wonderful. I'm supportive of that.
right?
I think we have
we're all
consensus
agreed.
on that guy.
But again, just purchase of service not coming out of ARPA funds.
I'd like to see the proposal, yes. And so, yes.
Perfect.
Yeah. I mean, yeah, I'm not gonna, I know some of them are that category, hopefully it's not all.
We can go through this whole process, vetting it, and have it basically done. So whenever the federal guidelines come down, it can move forward. You can say April 1st, but if the guidelines don't come down, it's not gonna happen.
What if they change the guidelines,
Keep in mind that.
right?
God forbid that would happen.
I'll give you a scenario,
They
okay?
give further clarification, they make people not acceptable.
PPP, idle loans, and a whole bunch of other programs, literally trillions of dollars, hundreds of billions, went out from the federal government to private businesses and nonprofits without final guidance, okay? So it happened during the pandemic and pandemic funding. It happened numerously. And it has been a moving target, and generally speaking, it's been okay. So, if we follow that lead, we'll be okay. There's been interim guidance, secondary guidance, final guidance. Normally, you don't have to wait till the very end, and no one has done that in the federal government and or those recipients with the last $4 trillion.
But that was a race for dollars. That was a race for people to get those PPP dollars. We have the money in hand. There doesn't necessarily have to be a race for it. The money's in our hands.
I'm just saying that's what has occurred.
Yeah.
So, just to give you context, don't be afraid of the big bad federal government going to come down and squash us. We have guidance, we've got a program, we've got a law, we have funding. The intent is to implement, and I think that's what we're trying to do. And so whether it's April or July, we don't feel or think it's going to be July 1. And so my proposal would be to shoot for July 1 from the board.
You are at a July 1 date.
Excuse me, I say July 1?
Yeah.
April 1, thank you.
Can we
for
get that in
correcting
writing?
me. April 1 as a goal date for our team organizing it.
to disperse on April 1st.
Have contracts ready to disperse based upon ones that we've approved by resolution.
Is that doable, Kevin?
I don't think we can answer that question without a key component with the county attorney not being here as well. Because this is going to require extensive review for each one of these. Even if it's the same contract, it's still going to require his review on each one. And it's a factor that we have to keep in the back of our minds.
So maybe what we need to do is establish the criteria for purchase of service, and then everyone who isn't inside the purchase of service criteria knows they can quit calling, because the reality is that you're not going to get this through until...
Well, I think the county has established who is purchase of service and who qualifies over precedent over the last number of years. I think it's fairly easy to look at the list and see who should go through under purchase of service.
They've all increased their amount. Look at Travel Dubuque. He was at 60, now he's at 120.
They haven't all increased their amount, though. I mean, some have, yes, that's correct.
Pretty much they have.
Any increase.
It's a nuance, that's what we're gonna deal with. We'll deal with that on the fly.
And that's what we got.
Board votes for 60, great. They vote for 120,
Well, and that's what we got for asking them to resubmit through this process, too. So,
Agreed.
Keep in mind, the benefit.
We opened that can of worms.
The benefit to our taxpayers is that we're using federal funds first, and that has a significant opportunity to keep those dollars local and to keep our fund balances at a proper area. So I'll defend that one all day long, is that's a better fiduciary and financial responsibility of the Board of Supervisors to our local taxpayers. That's the order it should occur in.
And I don't think anybody here is going to disagree with that.
Okay, good.
Including myself.
Well, I keep hearing pot shots.
But there are people on this list who have been waiting, who have already been approved, who were already gone through the process.
Who they are, let's start screening them. Let's get to Tuesday, and Monday of next week, start producing something.
I would just ask we don't give up on an earlier date for a later date, just because we're unknown.
And I would say let's not look at dates right now. Let's look at what we have in front of us.
Well, we need some...
As soon as possible.
Would we consider a short-term funding for somebody like CSCI from purchase of service contract, followed up by federal funds, if we've got people who are in that pinch?
I would prefer to look at the applications we have in hand in an orderly fashion. If their building's on fire, we'll call 911.
But this is a review criteria for them to use as they bring things forward.
And so everyone who calls me, I say, well, if you really think it's important and you think it's high priority, give Kevin a call and Della and Stan and Ed, and maybe they can get you in earlier. I don't like that. I'm
certainly not telling people that. I never have.
I think you stick to your process and your order. We've asked the community for their applications, and I think we develop a process, an orderly one, that they come to us. And we've just talked about purchase of services as the next batch. I think there's consensus on that. So let's get those going, and then it's what we or your group feel is American Rescue Funds after that. And so if the SCI was a purchase of service...
I'm confident that the four of us can come up with a way that is equitable for all three of you, that'll ameliorate some of the concerns that you're having, even at this very moment.
as well.
Look at all the ARPA ones that are up there. Purchase of services / ARPA.
Yeah.
Domestic violence shelter, line 50. Purchase of services / ARPA. That means it could be coming in under our general basic purchase of services contract, or it could come in under the federal government. We might want to ask them, hey, domestic violence shelter, shelter for women who are the victims of violence. Do you want to get purchase of services contract? We can do that for you in the next 6 weeks, or do you want to wait for July? That might matter to some of these nonprofits, based on the mission and the work they do.
I would say that they are mostly purchase of service / ARPA because we asked them to reapply to that American Rescue Plan Act portal.
Correct. And if American Rescue Plan had never occurred, these would have all been looked at and funded or denied funding.
Had their money quite a while ago.
Yes, correct. And they would have had their money a long time ago, yes.
Yeah.
So the likelihood...
Not all of them, but some.
From my perspective, the likelihood of many on this list being funded through ARPA is probably not very high. So they'll either be funded as a purchase of service or they won't be funded.
Right. I think we should also say that let's not start the next purchase of services contract. We're sitting here on November 15th, right? Let's not start the next one for December 31st, right? let's not go around down this again.
Who's that question to?
Well, there is a component that we don't want overlapping years. If we can get this stuff done, we need to get it done sooner than later. And if it's gonna happen under purchase, God, I really wanna say POS, purchase of services, then that should happen sooner than later, because we're gonna be looking at the same conversation, we're gonna be looking at the same applications
Right.
in 6 months or less.
Do we have consensus about that? Because Stella, last year you started that process. I didn't know you had started it, but you already sent it out.
So the question to the board is what?
Do we have consensus that we shouldn't start next year's purchase of service contract until these are concluded?
Well, I think we need to get these cleaned up, but then again, January we start the budget, that's 2 months away. I don't think we're gonna have this cleaned up by then.
So do you want Stella to go out and send out more contracts,
Or application?
applications for more funding?
If you're gonna look into July 1st of, 23 budget, well,
I think part of,
Can we resolve it? So, I think it's common. I wish it didn't occur, but I can tell you it's very common in state and federal budgeting that this does occur. And it's occurred every 7 years of mine, and I CC with a federal contract I deal with, okay? So budget amendments, continuing resolutions, and sometimes you're working on multiple contracts, multiple budgets within the same year for looking ahead and looking back. And so my vantage point, based on that experience, as much as I don't want to get another 30 to review, I think looking for fiscal year 23, I believe is the number we're talking about, applications for purchase of service with a new contract, probably makes sense to have that open when it normally opens and closes and goes through. So, yes, I think that should happen, but it's for fiscal 23. You have to kind of educate people. It's for fiscal 23 budget.
so we had discussed a little bit last budget session about the process and maybe adjusting the timing. And we did that a little bit this year in saying when we budgeted just a full number, and then said, we'll review the applications afterward. Well, it's extended because of rescue plan and all of the circumstances that we've faced in this last year. But I think what we would like to talk about during budget is that process and how that process should run and when those applications should open.
Another idea, so I hate to throw out variables, is that we have American Rescue Funding. It's unique. It's community service-based. Maybe we hold on our typical purchase of a service, AKA grants, for a year. An idea, and you could go, why are you doing that? Well, we're about ready to disperse $10 million in community funds, maybe not to the community, some's internally, and that makes sense. But you might get a small organization saying, but what about my $5,000? That's really important. And so, that's what you have to weigh. Right now, after kind of thinking that through my head, I would open up fiscal 23 applications for what we call purchase of service recommendations in late December like we do, and review them during budget time. That's kind of, I think we should do that.
I think there's also some merit to drawing a distinct line between purchase of service and ARPA.
Agreed.
I think that may have been a misstep in the first place that we made by asking some of these groups to apply through the ARPA process after they had already applied as purchase of service.
right.
I mean, it would make sense to have a line of demarcation between those two. That way there's no confusion as to, well, they didn't get one. Are they even eligible for the other one? Do we want to look at them for the other one? Because we're just creating more work on top of work.
Well, we're trying to fund more applications in the best and most, sensible way. But back to the point, I think you've heard my kind of final answer to your question, Supervisor McDonough, is yes, we should open purchase of services for fiscal year 2023 in mid or late December, as we've always have. That's where I'm at.
Yeah, I think we need to open it up for these nonprofits, for the $5,000 ones, like you said, that they depend on that grant that we give them.
All within the criteria of the auditor and that stuff. Sorry, I want to minimize your stuff, but your agreement.
Hopefully on Monday of next week, we'll give it to them again. the $5,000 ones that we've been holding up since December.
I think you have kind of consensus, at least that piece that was asked.
Do we have any changes to suggest to the contract? Or are we gonna go with the final recommendations of the county attorney?
The purchase of service contract, I read through it, I thought it looked good, so I didn't see anything that, but I'm not an attorney, so.
Is there anything that the review team feels we've left on the table or needs to be addressed for you to do your work?
No,
I think we have a good path forward, and we'll start revising everything and bringing more things forward next week.
And so how will the messaging go out from this meeting that the federal funding will not be released until after April 1st? That's for sure, right?
I would say yes.
So how will that be released to people?
I think we have an ambassador sitting in the room who can help us.
Well, that's not their responsibility, it's our responsibility. So who's gonna take up that pen?
And I think it'd be wise also to talk about it, just not to shoot that end date, but to say we are reviewing applications. We've got your applications, we're reviewing them. The Board of Supervisors will be making budgeting decisions related to those, and final awards will be post-April.
I think we can work on a letter to all of these organizations to go out that will explain the process a little bit better, so they know what our next steps are.
When will that letter go out?
We can work on drafting that this week.
But you don't want to send it to the purchase of service people that you're carving out first, right?
Right, right.
So you might want to wait a couple weeks. You could draft a letter, but I think it's important to communicate to them. And I think, while this has been, hey, dang, sooner, faster, bad, this, that, I think, I think we should step back and realize we have been ahead of the game. We were one of the first and one of the onlys to do a survey and ask for applications proactively. And so I think those are all good things. We do have to deliver on a result, a decision, and it might be taking us a little longer, but, there are some communities that, are still just thinking and pondering about what to do, where we have, fortunately, $60 million of ideas of what to do.
We could also, at least I would consider working on something with the city of Dubuque to do something with the arts. We have a few applications relating to fine arts. There's one from Bell Tower, and the city of Dubuque has a program. Would anyone be opposed to exploring that?
Well, that's a good idea. It brings me a point. So when should kind of supervisor-led or collaborated ideas, applications come forward? So it's a good one with the arts. There might be another good one with another opponent. When do you feel or think, the board wants additional ones to come forward?
You mean more applications?
Well, I think that's what you just talked about, the arts and work. Yes.
I'm still talking about structuring solutions and making categories of grants. And one of those is the arts. And the city has an art program. Is there a way for us to send any funding to the arts to the city?
I'd have to look at that. I don't know if we can pass our funding to other governmental bodies or not.
Okay.
I just don't know the answer to that.
But in the end, that's a new one. It's not on our list. So that's my question, is when will the new ones be considered? Because I like your idea. As a process, do you think that should be post-April or before April?
But I guess, are we going to open up applications for the second half of the ARP funds?
I think we should, but not until at least we get through all of these, which right now is somewhere between April and July. So I think we should, but it's going to be, later.
We won't get the second tranche until when?
May or later.
Supervisors,
I don't want to hold out to the community that there's additional opportunities. I think we need to get back to some of the requests from our own. We know there's people working on large ticket projects that aren't in any of these documents. They're nowhere. Yeah. So I don't think we should say, oh, we have room for more, when in fact, we probably have spent the full $19 million just with what we know is outstanding from people that haven't even applied.
Yeah, if I may, I think the idea and the understanding of at least our group was that this application process and this opening up to the public was for the full amount, and that we will not be in any way, shape, or form running a whole application process a second time. I mean, we have $70 million worth of asks.
I was just asking them.
Yeah.
Well, here, I'll throw out a caveat. So you've got three people right here. So, in roughly, 15 months, you could have a different board, and they might want to spend that money. And so I think it's naive to think that this is the one and only process. And so I would be open that I would keep it open. I would keep it open as kind of my comments, is that if this is all the greatest ideas we have, I think we should keep the process and the opportunity for funding projects open. Granted, I would like to review these, get these done, get them yes or no's, and let's use April to July as that time frame. After that, and that was my question, what's next?
So then,
now, if it's $0, then you kind of know the answer. Nothing.
So then, is it the purpose? Is the board saying that they are only looking to allocate $9 million and change for the current amount of applications, and that after we
That's
pass
all we
$9
can put
million,
out until we get the other half.
Well, $5 million of this is gonna make our own budget whole.
Correct. So you're looking at $4 million.
we're only talking about possibly
Yeah.
spending 4,
Right.
right?
and then we'd be opening it up for an entire new process of applications for that second
I'm
tranche?
not doing that,
It's unknown.
yes.
So,
I don't
mean,
intend to do that as we sit here.
Unknown, and I think, goes
I
back.
feel like that does a disservice to the groups that have applied, just as a personal commentary there.
If we did that, it's a disservice.
Yes,
Right.
absolutely.
No, I think we need to start producing something. But I do also think that there are some of the grant applications that do belong together, and that we might get a better product, a better application if they work on something together as compared to in silos. And that relates to the numerous requests that come in about workforce development.
And I would just go back to that good old saying, let's not bite off more than we can chew with some of these things.
Well,
There are going to
let's
be
get through
hundreds,
Monday.
there are going to be hundreds and hundreds of great
Right.
ideas that come through
Clear
here.
20 of these on Monday for us.
So I think we've made progress, in my opinion. I mean, we might have been jumping around, but I think we've made progress there. We're going to look at the purchase of service ones next. That's what you're going to organize. You guys are going to be helping and leading the process, which is awesome. And we feel or think that the awards for rescue funds, the first batch, whatever that would be, is somewhere between April and July of contracts signed. Right? That's good. And if
The last item that we placed on this agenda, and it might have been more my thought than anyone else, I don't know, but is for some kind of a scoring process, that we would develop some way to score the federal grant applications that is similar, so that there's an even view about what it is that we're scoring people on. Are we going to score? Are we just going to say, I like? Do we say things like, I'd rather prefer to put money into people rather than technology? Do we want to have an attempt to try to make a process that looks at some scoring? If we do, we can ask for the assistance of people who do this work, score applications. We just need to find someone who will help us get that skill set. Whether these folks are all trained to use the same scoring process, they still all come to us, or do we want to have some commonality of how we want to score things?
it absolutely did. At the front side of the process, I was an advocate for categorization and prioritization, which would lead to scoring. So I'm a big believer in that. We didn't do that. We said we want all applications. And so now to narrow them down after they've done their applications, I think also is a little out of sync. Now I know how the game's played, and my application's already in. So I wanted scoring, prioritization, categorization early from the Board of Supervisors. We passed over that, and so now I think we just take these at their merit.
I don't think one has to forestall the other. They don't negate the other.
We still could do it now. I agree. We still could do it now. When you ask the question.
Problem with, like Kevin and Dawn and Stella and Ed going through and kind of scoring them. They can make up their own scoring pattern and score them.
Yeah, I think that's something like that probably that's going to
grammar.
have to, something that's going to have to occur within our group regardless.
Right.
So I don't know that the conversation
Have
is.
to have some kind of way to put weight on one and not on another, and.
Correct.
Right.
And some of that's gonna come in the ways of, are these people who we want to be reporting? Are these people who we know that can handle
But they
asking?
won't do any scoring or work toward any of that if we don't direct them that we're okay with that.
Oh, no, we'll,
I've been told that you won't do that unless we have consensus that we want them to do that.
I mean, I think it's,
We're gonna have them going through these applications and trying to categorize them and sift them out for us to look at. They have to be able to use whatever means.
maybe on federal guidelines.
Do that.
But, I mean, how are you, so the bottom two, just an example. I mean, some days people would say, yeah, 100% funding, travel to Dubuque, 0 Fountain of Youth. They do two different things. The other person would say the exact opposite, 100% funding, Fountain of Youth, 0 for travel industry. I think having staff, government officials, getting in and prioritizing those two different unique things is not your role. That's our role. Now, you can grade them on the merit of applications related to fullness, punctuation, federal eligibility. I think that's key difference. But to judge them on the merit of their worth to the community is an elected official's role, which, Kevin, you are, but, you know, and I'm very interested in your opinion, but the end, the way the structure works and the way the federal government, state government has set this up is the Board of Supervisors makes that decision.
well, I think there's value to all of those things. I don't disagree with what you just said. I think there's a way that we can go through these and check them for completeness, make sure that these people can meet the reporting requirements, and also categorize them and put them into buckets where they're of similar asks or similar goals. And that in some cases we can determine or help determine what an individual project's impact to the county as a whole would be. It's ultimately up to you to decide whether or not you want to fund it. It lies with your pen stroke, not mine, not anybody else in this group. So we can make recommendations till the cows come home, but what you guys are going to fund is what you're going to end up funding. So at no point are we going to disqualify or remove items from this list. That will not happen. But if one of them comes along with a, hey, this one looks like it'll have a reach of 8 on a scale of 1 to 10 as far as how it reaches the community within the people of the county, well then, yeah, I'm going to put more weight on something like that than something that has a very limited reach to the citizens of Dubuque County. Because that is our goal at the end of the day, is to benefit the county as a whole, not just one small segment.
All right. So, let's take a 5-minute recess.
Can you make it 10?
We can make it 10.
Thank you.
Motion to recess for 10 minutes.
I will second.
Motion is second to recess for 10 minutes. We'll be back. Canvass the cities of Cascade, Dyersville, Zwingle, and Dubuque Community, Western Dubuque Community College, Community School Boards, Northeast Iowa Merged Areas Board of Directors. All in favor, say aye.
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 All right.
These are all signed, right?
These are all signed by other counties, so you're reading their abstract. We are the head control county.
Oh, my goodness, the head control county?
Yeah.
How do you sleep at night with that
I'm
responsibility?
president of the board of the head control county.
That's right.
Wow. I think I have all
So
of
you
them.
have to read, listen to what you have to say. Whoever wants to read first can go ahead.
Both
Want
sides.
to do one at a time, or what?
Yes. Well, you can just do your whole.
We can't all read at the same time,
Well,
can
no,
we?
not all read it.
I'm just confused still, and I'm probably done. Which ones do we have to read? Then read the whole thing that's listed here?
Well, not all of this, so it's the Dubuque Community School
Just read these
District
guys.
are at large for,
All right, I'll start
and
then.
their totals, and then you would,
State of Iowa abstract of votes, Dubuque School Director at Large for Dubuque County, Katie Jones, 4,531 votes. Derrica Williams Robinson, 2,413 votes. Nancy Bradley, 5,898 votes. Jake Elders, 2,944 votes. Anderson Sansi, 5,306 votes. Whitney Sanger, 4,340 votes. Cynthia Mueller, 4,490 votes. Scattering, 165 votes, for a total of 30,087 votes. That one done or no? And this goes together?
what you have to read them off. Yeah.
Well, I agree. Do you want me to read all of these right now? I mean,
Well, after the Dubuque School's done, someone else can read if you want a break, but they all have to be read eventually.
okay, I just normally just go back and forth, but,
It's a little bit different because it's.
all right. Dubuque County, Dubuque School Director at Large to fill a vacancy, Jim Prochaska, received 8,662 votes. Scattering received 138 votes. Whitley Joel, 717 votes, for a total of 9,517 votes. Jackson County, School Board, Dubuque School Board, Nancy Bradley, 15 votes. Jake Elders, 7 votes. Katie Jones, 12. Cynthia Mueller, 17. Anderson Sansi, 4. Whitney Sanger, 8. Derrica Williams Robinson, 4. Came to total 67, scattering 2. Total of 69 votes. Dubuque County School Board to fill a vacancy. Jackson, Jim Prochaska, 21 votes. Came to total 21, scattering 2, for a total of 23 votes.
I feel like some counties put both of the races on one paper. So someone else can go, or those are different races?
No.
Do that. So, Ann, you want to?
I've signed this. This was before us last week. I didn't sign it today.
Because this makes it official. One. So, yeah, you're gonna read more of your.
Do I need to read all this stuff?
Nope, so you're just.
Northeast Iowa Community College Director, District 9, Bob Schaefer, received 1,941 votes. Scattering, whoever that is, received 37 votes. Total, 1,978 votes.
They're just all right.
What does scattering mean?
The same as write-in.
Okay.
So if you want to read one more, so this is, so it was, so what is,
Northeast Iowa Community College Director, District 4, Kenton Nelson, yes, go ahead.
Clayton County.
Clayton County.
Okay.
Northeast Iowa Community College Director, District 4, Kenton Nelson, received 139 votes. Scattering, received no votes, good to know. Total 139 votes, and then what else do you want me to do?
So now it's Buchanan County.
Oh,
Northeast
Buchanan
Iowa
County.
Community College.
Northeast Iowa Community, Kenton Nelson received 147 votes. He received 147 votes. Scattering 1 vote, total 148 votes. Abstract, State of Iowa, Fayette County, Northeast Iowa Community College District 4. Director, District 4, Kenton Nelson received 414 votes. Scattering was lucky enough to get 2 votes, total 416 votes. Delaware County, Northeast Iowa Community College District, Director, District 4, Kenton Nelson received 1,338 votes. Scattering was 10 votes, total 1,348 votes.
Read in the abstracts from all the counties. Declare the winner. So like it's Dubuque County. The Delaware County.
For City of Dyersville Mayor, Jeff Jock received 918 votes. Elvin Haas received 332 votes. Scattering received 1 vote, total 1,251 votes. Delaware County, City of Dyersville Mayor, Jeff Jock received 48. Elvin Haas received 33. Scattering 1. Total 82 votes.
You wanna do another one?
Yeah. We ready for me, Ray?
Yeah.
Awesome. Dubuque County, abstract of votes, Western Dubuque School Director, District 1, Mark Tilson, 3,015 votes, scattering 42, for a total of 3,057 votes. Backside or no? Delaware County, Western Dubuque School Director, District 1, Mark Tilson receives 86 votes, scattering 1, total of 87 votes. Whoa, look out. In Jackson County, Western Dubuque County School Board, Mark Tilson, 21 votes, total candidates 21, scattering 5, for a total of 26. Western Dubuque County School Board, Mike Ray, 15 votes, Nicole Seckline, 20, total candidates 35, scattering was 0, for a total of 35. And Clayton County, Western Dubuque School Director, District 1, Mark Tilson, 0, scattering 0, total votes 0.
City of Dyersville, City Council at Large, Ashley Wallers received 286 votes. Tom Westoff, 942. Scattering 0, total 1,228 votes. City of Dyersville, City Council at Large from Delaware County.
Want to sign these two?
Ashley Wallers received 21 votes. Tom Westoff, 60. Scattering 0, total 81.
Go ahead, Harley.
City of Dyersville, City Council, Ward 1, Jim Gibbs received 305 votes, scattering 3 votes, total 308 votes. Delaware County Precinct for City of Dyersville, City Council, Ward 1, Jim Gibbs received 77 votes, scattering 0, total 77 votes.
Keep going.
Okay. City of Dyersville, City Council, Ward 3, Michael Overbrockling received 413 votes. Ben Ellison received 70 votes. Manessa Gall received 47 votes, scattering 0, total 530 votes. Okay. City of Zwengel, City Council at Large, Joe Heister received 14 votes. Mike Petchy received 9 votes. John Marcus, 5 votes. Joan Cundy, 6 votes. Helen Brown, 11 votes. Diana Freisinger, 4 votes. Allie Chapman, 7 votes. Scattering, 9 votes. Total, 65. City of Zwengel, Mayor Russ Ryan received 3 votes. Scattering received 5 votes. Mark Harting received 7 votes. Total 15 votes. Jackson County Precinct for the Zwengel Mayor. Russell Ryan received 1 vote. Write-in Mark Harting received 5 votes. Candidate total, 6 votes. Zwengel City Council, through Jackson County. Helen Brown received 6 votes. Ally Chapman received 3 votes. Diana Freisinger received 3 votes. Joe Easter received 4. Joan Cundy received 5 votes. John Marcus received 2 votes. Mike Petchy received 3 votes. Total 26 votes.
Northeast Iowa Community College Director, District Number 2, Kathy Gunderson received 14 votes. Scattering was 0, total 14 votes. Fayette County, Northeast Iowa Community College Director, District 2, Kathy Gunderson received 105 votes. Scattering was 1 vote, total 106 votes. Chickasaw County, Northeast Iowa Community College Director, District 2, Kathy Gunderson received 72 votes. Scattering was none, total of 72 votes. Winneshiek County, Northeast Iowa Community College Director, District 2, Kathy Gunderson received 1,214 votes. Scattering was 10, total 1,224 votes. Want to go ahead?
Yep. Clayton County, Western Dubuque School District, District 3, Mike Ray, 0. Nicole Steckline, 0. Scattering, 0. Next. Dubuque County, Western Dubuque School District, District 3, Mike Ray, 2,156 votes. Nicole Steckline, 1,258. Scattering, 20. For a total of 3,434. And Delaware County, Western Dubuque School Director, District 3, Mike Ray, 40, Nicole Steckline, 49, scattering 0 for a total of 89 votes.
City of Cascade Mayor, Mike Henry received 163 votes. Sue Nepper, 188 votes. Steve Nepper, 213 votes. Scattering 6 votes, total 570 votes. City of Cascade City Council at Large, Riley Rauch, 442 votes. John Basinius, 118 votes. James Bruns, 31 votes. Megan Oliphant, 313 votes. Michael Delaney, 308 votes. Bill Hosh, 260 votes. Patrick Lightson, 73 votes. Scattering, 4 votes. Shirley McDermott, 38 votes. Total 1,587 votes. Cascade, City of Cascade Mayor, Jones County Precinct, Mike Henry received 31 votes. Sue Nepper, 50 votes. Stephen Nepper, 53 votes, 134 votes. City of Cascade City Council at Large, Riley Roush, 97 votes. John Basinius, 18. James Bruns, 9. Megan Oliphant, 77. Michael Delaney, 71. Bill Hosh, 56. Patrick Lightson, 37. Shirley McDermott, 15. Total 380 votes.
Clayton County, Northeast Iowa Community College Director, District 1. Sue Runyon received 4 votes. No write-ins, total 4 votes. Howard County, Northeast Iowa Community, Kathy Gunderson received 45 votes, 1 write-in, total 46. Northeast Iowa Community, Howard, Sue Runyon, 89 votes. Sue Scattering, total 91 votes. Mitchell County, Northeast Iowa Community College Director, District 1, Sue Runyon received 119 votes, scattering 0, total 119 votes. Bramer County, Northeast Iowa Community College Director, District 1, Sue Runyon, 0, scattering 0, total no votes, 0. Fayette County, Northeast Iowa Community College Director, District 1, Sue Runyon, 1,032 votes, scattering received 6 votes, total 1,038 votes. Chickasaw County, Northeast Iowa Community College Director, District 1, Sue Runyon received 476 votes, scattering received 4 votes, total 480 votes.
Clayton County, Western Dubuque School, public measure HA, yes, 0 votes, no, 0 votes. Dubuque County, Western Dubuque School, public measure HA, yes, 2,326, no is 1,093, for a total of 3,419 votes. Jackson County, abstract of votes. Looks like WD revenue proposed statements. Jackson County, for the question, there were 19 votes. Against the question, there were 7 votes, for a total of 26 votes. Delaware County, Western Dubuque School, public measure HA, yes 62, no 34, for a total of 96 votes. Jones County, Western Dubuque School Director District Number 1, Mark Tilson, 154 votes, scattering 1, for a total of 155. Western Dubuque School Director District Number 3, Mike Ray, 150 votes, Nicole Steckline, 55, for a total of 205. Western Dubuque School, public measure HA, yes 120, no 29, for a total of 149 votes.
Clayton County, Iowa, Northeast Iowa Community College, Director District 6, Gary McAndrew received 0 votes, scattering 0 votes, total 0 votes. Dubuque County, Northeast Iowa Community College, Director District 6, Gary McAndrew received 3,670 votes, scattering 36, total 3,706 votes. Jackson County, Iowa, Northeast Iowa Community, Jackson County, Gary McAndrew, 26 votes, scattering 2 votes, total 28 votes. Delaware County, Northeast Iowa Community College, Director District 6, Gary McAndrew received 58 votes, scattering 0, total 85 votes, total 85 votes. Northeast Iowa Community College, Director District 6, Gary McAndrew received 161 votes in Jones County, scattering 2, total in Jones County, 163 votes.
Thank you, Jenny.
Is that it?
Thank you, Jen.
Fantastic. Well done.
Awesome, yeah. So, there a further list we need, or?
No, I think you can.
He's being recognized.
Oh, yeah, I'll make a motion to adjourn. Motion to
I will
adjourn.
second.
Motion and second to adjourn. All in favor, say aye.
Aye.
Motion carries. We are adjourned.
I'm not sure what you do with that, but you probably should grab Dawn and somebody behind you to start pushing buttons. Turn that dang thing off. Is that list need to be reviewed at all, or is it done?
I don't, I mean, I haven't looked at any list of little ones. Did you do this one, Harley?
I did all of them.
So I'm happy to review it, but I don't want to take that opportunity away from you.
You're a little too early.
So here's one that Harley has looked at for signature.